Ionella Chamber. I'm Anissa Essaibi-George, Chair of the Committee on Homelessness, Mental Health, and Recovery. I am joined with my colleague, Councilor at Large Michelle Wu, Chair of the Committee on Planning, Development, and Transportation. This is a joint hearing for Docket 0170 regarding the reconstruction of the Long Island Bridge and the reopening of recovery service facilities. This hearing was sponsored by myself, District City Councilors Andrea Campbell, our Council President, and Councilor Frank Baker. For housekeeping, I want to remind everyone this hearing is being recorded and broadcast live on Comcast 8, RCN 82, and Verizon Channel 1964. Please turn off your cell phones and any other devices that make noise. I'd like to ask everyone who's with us today to please sign in. If you'd like to speak after our panelists, please check the yes box. We are also joined today by our colleagues, Councilor Ed Flynn, and Councilor Josh Zakum. Next Tuesday, October 8th, marks the 4-year anniversary of the evacuation of all recovery programs and homeless shelters on Long Island due to the imminent failure of the only bridge linking the island to the mainland. The closure eliminated hundreds of recovery beds and hundreds of shelter beds for the homeless population in Boston, which really has put a lot of pressure on our city's resources. Despite making up the 742 shelter beds and 225 recovery beds that were lost after the closing of the Long Island Bridge, the opioid crisis has furthered the need for facilities on Long Island. Today is an important informational conversation to have as a council as we support the mayor's administration to take the next in our fight to end the current opioid and health epidemic. We need this new state-of-the-art recovery center. We need it now. I look forward to this hearing and hearing from our panelists around the status of the bridge, the island, and its facilities since termination of services in 2014. I hope to learn about the planning, the status of permitting, and the state-of-art recovery campus that we plan on that island. I will now introduce my colleagues, starting with Councilor Wu, and then in order of arrival for comments. I'd also like to welcome and note that we've been joined by Councilor Mark Siomo and Councilor Frank Baker. Councilor Wu.
Thank you, Madam Chairwoman, and I'm proud and pleased to co-chair this with you. Any neighborhood meeting across the city, folks are talking about the need for more and better and more accessible services and treatment for recovery, and also about the impacts that a growing opioid crisis is having on Boston and every neighborhood. So I'm really pleased to be here to get an update from the administration on the efforts, particularly as this is, once again, an issue that Boston is taking on and supporting that has much larger impact and attempting to fill a gap that is much larger than just within our borders. So we know there are many levels of government and even other governments within the same level of government involved, but appreciate so much that my colleagues have called for this hearing. Our Council President, Andrea Campbell, our chair here, Councilor Essaibi-George, and Councilor Frank Baker, in making sure that we continue to have these ongoing discussions and tracking and keeping up on what both the long-term goals are, but also the steps in between. Thank you.
Thank you. Councilor Flynn.
Thank you, Madam Chair, and thank you to Councilor Wu and Council President Campbell and Councilor Frank Baker as well for your great work on this issue. Prior to this position, I was a probation officer at Suffolk Superior Court for 10 years and had the opportunity to visit Long Island at least once a week, supervising people on probation. And it was almost an honor for me to visit the island. I observed firsthand the tremendous level of support that a lot of probationers did receive on the island, drug treatment, mental health counseling, job training, drug testing as well from the probation staff. And, I also noticed over the years that the bridge itself, this was maybe 6, 7 years ago, the bridge itself was deteriorating almost weekly. You could see it happen. And, looking back at it now, I think it was one of the best decisions ever made by a mayor was to shut down the bridge immediately. And that's what Mayor Walsh did because it was desperately falling apart. I observed that every day. And I also observed the hard work since that time from this administration of trying to help people get into drug treatment programs, coordinating services. So I stand today and just want to acknowledge the hard work of the city administration and my colleagues in government that are also working hard on this issue as well. So I'm proud to be here. Thank you, Madam Chair.
Thank you. I'd like to also note that we've been joined by Councillor Campbell, Councillor O'Malley, and Councillor McCarthy. Councillor Zachem.
Thank you, Madam Chair. To be very brief, I look forward to hearing exactly what we're going to be doing about this. I remember going with Councillor Wu shortly after we were sworn in 2014, and some of our staff and others to see the facility. And even then, they said, and I was in a little Honda Civic, they said only one car at a time across the bridge. So certainly, this has been a long-standing problem. I'm glad we're addressing it. I know that Mayor Walsh and your team and the administration is working hard to fix this because it is a needed resource. I know many of my colleagues, in particular the chair and others, have talked about how so many folks who are suffering from addiction issues from surrounding communities come to Boston, and that we are bearing quite a burden. And we are doing that because we provide services, because we want to make sure that people have the services they need. But having this facility available, I think, is incredibly important. Look forward to hearing from you and seeing how this body can support the reopening and the expansion of addiction and recovery services for everyone in the Boston area. Thank you.
Thank you, Councillor. Councillor Siomo.
Thank you, Madam Chair, and let me join my colleagues in thanking you and the other members who have brought this forward. We're going to need a lot of cooperation. It seems like we're spearheading this effort, but we need cooperation from our neighbors in Quincy and other state agencies, and this is going to be quite an undertaking. And in order to keep the ball moving, we want to be your partner to make sure that we keep following the steps and get, periodic updates on how we can be helpful to keep advancing this ball. It's so needed, not just for the city of Boston, but certainly for the whole region. So thanks again, Madam Chair.
Thank you. Councillor Baker.
Thank you, Madam Chair. Thank you for having this order, and also, Council President, thank you for your leadership. I think we have an opportunity here to really look and think differently about the way people are getting healthy. The way it's happening now, we're almost a victim of our successes, that we do it as a city better than anybody else. So we're drawing more and more people. That being said, I think if we can look at the Long Island as an opportunity for really long-term treatment because 6 months, 9 months, 6 months, 9 months is it's not enough. And the wake that we will have from what's happening today and the previous however many years you want to put on, when did the opioid crisis start? We're going to have generations of people that don't have any life skills. We're going to need to bring people back from, get them off the opioids, and then it becomes life skills. Learning how to communicate normally again, learning how to work again if they were ever got old enough to be able to have a job. A lot of people that are out there they went from teenage years, preteen years, right into this life. So how are we going to get those people healthy? It's not going to happen unless we have come up with a regional plan that happens at Long Island. And I thank you guys for, pushing this project forward. Let's not lose sight of what we're trying to do here. The bridge needs to come first, and that's where we'll see all the political back and forth, but we need to get this bridge built. We need to show our neighbors that we're serious about this, and I'd like to hear about what the plan is for as the bridge is being built. What's going to happen for services out there, and so we can look at Quincy and say, well, we're doing these things now. We're not looking to, at least I hope we're not looking to, take our problem that's happening in the South End and Southampton Street and dump it on Long Island. We're thinking about it, that we want people to get healthy, and this should be a regional opportunity. This isn't just Boston. We're handling a lot of this crisis as far as Maine, New Hampshire, people from down south. So I look forward to this. I think that this is a once-in-a-lifetime opportunity. Unfortunately, we have to use all these resources to just get people so they're okay. So thank you.
Thank you, Councilor. Councilor Campbell.
Thank you, Councilor Essaibi-George, and thank you for partnering on this hearing order. You know, we called for it to get more information, but also not to keep that information with us, but for the public to obviously know what the plans are when it comes to reconstruction of the bridge, when it comes to the programming that's going to go there, but also an opportunity for them to weigh in as to what that plan should be. We obviously know that we are sort of in a crisis point. We have letters here from different civic associations and business leaders, particularly around certain neighborhoods in the city of Boston that are struggling because of the activity that's currently happening on some of our city streets. So we know that we need the bridge rebuilt. So I hope you consider us a partner in this. Here to sort of listening to you guys, also to thank each of you for the work that you do, not just with respect to this issue, but many other issues. I'm looking at you, Trish, because of your work when it comes to new schools and other work that often doesn't get recognized. So thank you, and thank you guys for being with us today. I'll quickly just add, you know, Councilor Baker, I've learned a lot from. We share Dorchester. He's District 3, I'm District 4. I know he's passionate about this issue, and so when he talks about programming that is longer, a location that is safe, but also not a location that forces people back out in the street after a certain period of time, that gives them a space to truly have an opportunity at successful recovery and rebuilding of their lives. Places and spaces even for us to interact in a more human way in order not only to meet their needs, but also to see how many of these folks can also meet needs of community in other ways as well. So I think there's a real opportunity to expand this outside of just the construction of a bridge, programming to be even more thoughtful and innovative and creative about what can actually happen here. So I'm excited to support the mayor and his decision to rebuild the bridge and you guys in the work and for the hearing today. So thank you. And thank you, Councilor Essaibi-George and Councilor Wu.
Thank you. Councilor O'Malley.
Thank you, Madam Chair, for your leadership on this, and as well as the Council President for her leadership as well, and delighted to partner with you and be here today. I don't need to be repetitive. All of my colleagues have been absolutely accurate, and I think they're very thoughtful remarks underscore the fact that the weight of this issue, the enormity of this issue, the need to fix the bridge, to rebuild the bridge, and be able to offer services and recovery programs for those that need it. I think Mayor Walsh has shown tremendous leadership on this issue. I think all of you have shown tremendous leadership. Sit here ready, willing, and able to partner any way I can. There is an epidemic happening on our streets. We see it acutely. It is affecting every neighborhood. It is affecting every family. And it is high time that we work to make sure that we can offer thorough and effective treatment to those who need it so desperately. Thank you, Madam Chair.
Thank you, Councilor. Councilor McCarthy.
Thank you, Madam Chair. Thank you, everybody, for coming. I think Councilor Baker said it best and clearly. You know, there's long-term goals and long-term solutions are needed. When I was in Public Works, my office used to be right next to Paras, and, you know, we're talking 10 years ago, we were talking about this bridge, and this administration got saddled with a complete white elephant, and they've done a wonderful job of addressing the problem. That bridge was going to fall into the harbor, and I think this administration addressed it as best as they possibly could. I'm looking forward to hearing about the timetable, how fast we can move this along, and I clearly think that you know, the people who are on the street who are suffering from you know, the victims of this opiate crisis need the help, obviously short-term and long-term. And I also think the other side of that is the businesses and the neighbors who live in these neighborhoods that see it and live with it every day. It's negatively affecting their quality of life too. So as much as the opiate crisis is hurting, obviously, the people who are enthralled in it themselves, it's clearly negatively impacting the businesses in that area as well as the neighbors. So I'm looking forward to moving this as quickly as we can. So thank you very much.
Thank you. And thank you all for being here. I'm not sure who's planning on going first, and Chief Martinez.
I get the excitement to go first.
Right, if
so.
you introduce yourself for the record, please, Chief, and we'll go from there.
Absolutely. Chief Marty Martinez, Chief of Health and Human Services for Mayor Walsh and the administration. Thank you, Councilor Essaibi-George and Councilor Wu for sort of leading this effort, and thank you to all the councilors who are here today to get an update on the work of Long Island, both the bridge, the building, or I should say the bridge, the buildings, and the campus. And so we are going to sort of do it in that way. We're going to talk first about some of the services, we'll talk about the bridge, and talk about some of the work around the buildings and understanding what exists there. So we're going to do it in those buckets. Before giving some background, I just want to acknowledge all the comments and all the notion of having to create a long-term plan is exactly what the administration's working on. We understand that very specifically, recovery is not just about treatment programs. It's a portion of what it means to create a campus. And so we have an opportunity here, and it's really a sort of a once-in-a-lifetime opportunity to look at the island sort of holistically. Think about the services that are there, thinking about the opportunities that are there, thinking about the gaps that currently exist in the continuum of care, and working to make sure that we can create opportunities for folks to not only get what they need in terms of treatment, but to also get what they need to stay in long-term recovery. So we really are talking about how do we strategically think about the services that are there to be able to meet the needs of this epidemic that we're facing today. I don't need to tell you about the epidemic. You see it every day in our communities, in our streets, and we're working to ensure that we can tackle it. A little bit of background before I tell you about some of the process we've been going in, really led by Health and Human Services and the Mayor's Office of Recovery Services, Jen Tracy and Brendan Little, who are with us today, and our folks from the Boston Public Health Commission. We're sort of leading this effort to understand what needs to be there. As you all know, when the bridge closed, Mayor Walsh, along with a variety of community partners, prioritized relocating essential homeless and recovery services, and more than met that goal. The city also increased capacity within 2 years to be able to do that. Recovery service and homeless service programs had to come together, and some of those providers are here with us today, to make sure that services did not get lost. We didn't have an opportunity that we could just say, the bridge is closed, the services are no longer needed. The services were needed, and they're needed even more today. The mayor was already halfway through creating what was the Mayor's Office of Recovery Services, the first municipal recovery services office in the country when the bridge was closed. And so the mayor's commitment to reimagine how we think about delivering services around recovery and treatment was aligned with the creation of this office. Since then, as you all know, the city's invested roughly over $60 million in combating addiction in our city, increasing access to services, public safety, outreach strategies, streets, all the services that the city provides. We've invested over $60 million to do that, and we have to continue to provide those resources. We live in a city that has great services and great addiction and treatment services, and is leading the country, the city, and the nation in some of those services. But there are still gaps in those services, and that's part of what we're trying to look at when we think about the planning of the Long Island campus. Since 2013, the epidemic has raged onward. So while the bridge closed and services were replaced, the epidemic has only grown and has taken more lives and leaving more people in need and in care here in Boston and across the Commonwealth. Since 2013, the city has had more than 1,000 deaths related to the opioid epidemic. Our EMS data, our hospital data, our community provider data shows us that this epidemic has not turned the tide. The state generally has reported a turn in that data, but that's not what we've seen in the city, and it's not what our partners have seen. And so we must continue to think about the services that are necessary on the island to meet this growing demand and ensure that we're doing everything we can to create a campus that is going to meet that demand. So some of the things that we're continuing to do, to give you an understanding, we've spent the last several months collecting data, talking to hundreds of individuals, providers, community organizations, the state, our hospitals, our community health centers, to understand what are the gaps in services today. What are those gaps? Where do we need to see more resources and more services? And how do we ensure that we are going to help turn the tide with the creation of this campus? So we've had focus groups here in Boston, outside of Boston as well. I don't need to tell you, and I think Councilor Essaibi-George has said this more than once, as of others, many people are coming regionally to take advantage of our services because there are so many. And so we are a regional hub for all of our services, not just services related to recovery and treatment. And so we had focus groups outside of Boston, in the North Shore and in the South Shore, to be able to hear from providers doing that important work. We had key informant interviews, which we continue today, to better understand from the recovery community what are some of those pieces that folks need. What are the gaps in terms of reaching adolescents who are struggling with these issues? Ensuring that we create services around equity so that all communities can access these services as the face of the epidemic continues to change. So we've continued to collect data and information and look at not only the qualitative information we've collected, but the state data, numbers of beds, what are the gaps in terms of when someone gets into detox and then goes to the next continuum or the next level of care, what are those gaps in beds there so we can understand what keeps people from staying in care and in treatment. We've been able to do that while working with the state as well. As many of you know, the state is going through a planning process around the Shattuck, and so we've been able to stay in conversation, have members of the state make sure we understand what they're doing through their process so they can understand what we're doing through the planning process in Long Island. As we plan this campus and collect all this data, we're doing it in a holistic way. There were many important services in Long Island before the bridge was closed, but many of those services were not intentionally thought out together. They were put in individually. There was different agencies and different programs that were put in, not necessarily all aligned or connected to one another. And so we're using this opportunity from a public health approach to understand what are those gaps as we create this campus. The next step in this process for us will be to create another opportunity for residents to weigh in. This week, we will release a request for information, a call for community residents, community groups, neighborhood associations, others who want to weigh in on what they think the campus should include. How do we best use our open space? How do we think about this opportunity to build this campus in a way that includes the best resources that are needed, but also services around job training and other programs that will keep people engaged in recovery and keep people engaged in their path to becoming healthy. That request for information will allow us to have an open process for anyone to weigh in, to be able to provide their input, and to be able to ensure that we're being as transparent and open as possible as we plan this campus. We're going to spend the rest of the next couple of months collecting that data and be able to lift up what are those main themes that need to exist and what are those buckets of services that need to exist on the campus. We can tell you from some of the work we've already done, there's not an intention to return our homeless services to the campus. We're going to keep those homeless services on the mainland, if you will. We're going to keep them in the city. But we are looking to understand what specific levels of services need to exist on the island. Now, I don't need to tell you that we have an understanding of what those gaps are today, but remember, this island is going to give us an opportunity to plan for the future. And so we're planning not only a first phase of services, you'll hear more about that when we talk about the buildings. There's going to be a first phase of services, and then there'll be a second phase of services, all under a larger vision of what this campus will include. So as we collect this data, it's given us the opportunity to understand what those gaps are and given us an understanding of how to raise up what some of those issues may be that we're trying to work on. The last thing I'll share with you in terms of our process on the services, we don't need to recreate things that already exist, but we do need to plan for the future. As in any epidemic, the face changes, there's additional issues that come up, there are additional ways that the disease could impact the community. And so we are going to continue to look into the future as much as we can to try to understand what needs to be on the campus and continue to do this planning so that we're ready to create the campus as necessary. So as our folks, I'm going to turn it over to Chief Osgood in a second to talk about the bridge. While that process is going, we're collecting all the data and information we can to ensure that we create the best possible campus in an intentional way to meet the needs of this epidemic. I assume we'll take questions at the end of the panel, but I just stress that the work we're trying to do is to make sure that we're not only planning for today, but we're planning for tomorrow as well. So I'll turn it over to Chief Osgood to talk about how we get to all these services, the bridge.
Thanks so much, Chief Martinez. As the Chief said, the goal here is to open a regional recovery campus on Long Island, and as the Mayor has made clear, as each of you has made clear, as many of the program providers in this room have made clear, in order to open that regional recovery campus, we need to reconstruct the Long Island Bridge. So I'm going to walk through three quick things. One, an overall description of the bridge project. Second, a timeline. And third, to Councilor Essaibi-George's point, the actual permitting process and where we are in that. So the bridge overall, as folks may know, the original bridge was constructed in 1951. As Councilor Essaibi-George noted, 4 years ago, in 2014, the bridge was closed, and through PAR's work, there was removal of the superstructure of the bridge. We have started the process to reconstruct that superstructure under the leadership of Parajaya Singh, who's the city's lead engineer. That bridge is funded through the city's capital budget, through the budget which you passed this past spring. There's around $108 million for the bridge overall. That includes some of the design work as well as some of the previous construction work that was done with the bridge. The recent allocation in this current fiscal year was an additional $80 million, of which $50 million is general obligation bonds and $30 million is from the parking meter fund. The bridge, as folks may be well aware, it's roughly 3,000 feet in length. Our program for the bridge is very similar to what was there before, but the bridge that we will be building, the superstructure that we will be building, will be more environmentally friendly and more sustainable. So that superstructure will have one lane going in and one lane going out to and from the island, and it will include sidewalks and lighting on the bridge structure itself. The previous bridge, though, handled stormwater runoff by simply draining it into the harbor through a series of scuppers. We are actually changing that with this new bridge and taking all the stormwater and treating it before having it go into the harbor, that way being more environmentally friendly. Additionally, with an eye towards sea level rise, we're making sure that our approach to the superstructure itself is prepared for some of the climate changes that we expect in Boston Harbor. Very importantly, the means and methods that we're taking as we build this bridge are being done with an eye towards minimizing to the extent possible the impact we're going to have on the environment, as well as any abutters, including our neighbors in Quincy. This means that much of the bridge actually will be constructed off of or sort of on land and actually floated in sections out into Boston Harbor and then floated into place using 13 of the existing 15 piers from the previous bridge. The course of this year, to talk a little bit about the timeline, the course of this year and a little bit of next is really about permitting and design. Our expectation is, on an aggressive sort of timeline, that we will go out to bid for construction next year, with construction completing in 2021. There is a series of permits that we are walking through, public permitting processes that we're walking through, both at the federal level, the state level, and the local level. At the federal level, that permitting work is both with the Army Corps of Engineers, and the lead entity is actually the U.S. Coast Guard. The U.S. Coast Guard and the Army Corps of Engineers really focus a lot of their permitting work on the navigable channel. One of the key elements of this bridge is that it is spanning an important navigable channel in Boston Harbor, and that navigable channel will remain open when the bridge is complete. At the state level, there's two major sets of permitting processes. The MEPA process, the Massachusetts Environmental Policy Act process, as well as the Chapter 91 process. Through the support of many of you in this room, on the City Council in particular, but also many of the program providers, we have successfully gotten through the MEPA process, where MEPA issued a certificate for our notice of project change, basically affirming that the approach that we were taking was environmentally sound, and affirmed that we could be able to progress the process without doing a subsequent environmental impact review. The other portion of the state review process is Chapter 91. Chapter 91 is largely focused on ensuring that there remains public access to the public sort of title right-of-way. We'll be going through that process over the course of this year. The other process which we are going through over the year ahead is really the local permitting process. The local permitting process is both with Boston and with Quincy. This is the Boston Conservation Commission and the Quincy Conservation Commission. In both those cases, those conservation commissions really focus on the impact that a project has on wetlands. The Boston Conservation Commission in June of this year issued an orders of condition, essentially allowed us to proceed with our project on the Boston side. And the Quincy Conservation Commission on June 6th had invited us for their first public hearing. We came and provided public testimony then. We actually came back again on August 1st to offer additional testimony. We came back again in September for September 5th to offer additional testimony to the Quincy Conservation Commission. As folks may be aware, they issued a negative order of condition, which was a determination about our project. We are planning on appealing the Quincy Conservation Commission's negative order of condition to the state, to the DEP, which is the typical process. Throughout all of these stages, throughout all of these public permitting processes at the federal level, the state level, the local level, there's opportunity for public input from all of you, from the provider community, from residents in Boston and Quincy and beyond. And we are very interested in inviting that feedback for us. It's incredibly helpful for us in this process. And with an eye towards figuring out how we actually continue to keep everybody informed about the process in front of us, opportunities for engagement, and to stay up to date on the status of the bridge project, as well as the larger work that Chief Martinez and Tricia Lyons are working on. The city will be shortly launching a website on boston.gov at boston.gov/Long Island, where people can keep up to date about information on this project and where we stand in our efforts to reopen that regional recovery campus. So with that as our quick overview of where we are on the bridge, I'll turn it over to Tricia Lyons, who leads the Public Facilities Department, and to Council President Campbell's point, all buildings within the city of Boston really get built through her leadership and her team's stewardship.
Thank you, Chief Osgood. As Chief Martinez and his team are defining the services that are going to be needed on the island, and Chief Osgood is finding a way for us to have some reliable way to actually get there, the Public Facilities Department is supporting this effort by making sure that we have buildings and infrastructure available on the island that will support the services that will be defined in the greater vision. To that point, we are currently underway basically taking an inventory of the buildings and the structures and the conditions on the island so that we can start to build a database of knowledge of what we have to work with. We've hired a consulting architectural and engineering team that has already been out to the site and visited each of the buildings and started to analyze building systems, building conditions, site conditions, utility conditions, code requirements, all kinds of condition analysis on the buildings out there. And the goal of this is to formulate a final plan by the end of the year so that we know what we have to start with, that we will have some sense of needs and requirements and costs by the end of the year. And again, that's existing conditions. That's what we'll be focusing on at this point. As the efforts continue on determining what kinds of services will be required out there, we'll start to build work with Chief Martinez's team to build a master plan of what the recovery campus wants to look like in the future. And we'll start to make a plan for phasing some building repairs or a master plan of infrastructure that will support those facilities. So essentially, we're on track to have some really good basic information by the end of this year that will be able to be used in the upcoming budget cycle, should we start to define projects that we would like to get underway. Our ultimate concern would be that we want to have usable buildings in time for, once the bridge is open, to be able to be used. And so the ideal plan would be to sort of start to think about what the projects need to be and ideally get some underway as early as next year. And so once we have that sort of inventory, we'll be able to work with Chief Martinez to build a future master plan that could be phased in a reasonable way.
Thank you. Is Para presenting? You're here to answer questions should they arise. Well, thank you all very much and for that presentation. I just want to add to Chief Martinez, you opened up about the crisis and what we see. I would say that the population, the group of individuals that are going to most benefit from the work that will eventually be happening on Long Island are the folks that we don't see and the crisis that they're experiencing as well. Chief Osgood, would you just run through the costs once again? Because you outlined them pretty quickly. I just want to make sure that I have them correctly.
Absolutely. So obviously, until we actually go to bid, we cannot say with great specificity our final cost for the bridge. The original expectation is sort of in the $90 million range. What is currently, if you look in the city's capital budget, there is currently $108 million in there. That does include some of the previously expended resources for the actual removal of the superstructure. So the addition that went into the FY19 budget is that addition of $80 million of both general obligation funding and parking meter funds. Again, our expectation is sort of in that $90 million range, but until we actually go to bid, it's too soon to put a specific number on it.
Great, thank you. And then on the permit process, we didn't have any mention here yet this morning about the structurally sound, the soundness of the structures that still exist for the bridge footings.
Right. So there are 15 piers that exist that held up the original superstructure. 13 of those piers would be reused for the new bridge. One of the things which has been asked about is the structural integrity of those piers. Part of the design plan is to actually strengthen those piers, and our design team, STV and TRC, they feel very confident that those piers, through the method of construction that we are proposing, will be strong enough to uphold the superstructure for the lifespan of the bridge.
Great, thank you. I'd like to just recognize that we've also been joined by Councilor Presley and Councilor Flaherty. Councilor Wu.
Thank you. Thank you to the panel for your presentation. And I know you all have given some briefings past, so apologies for repetition. How many beds or how many people do you project now to be able to offer services to on the island on a daily, monthly basis? And how are you projecting what the need might be, and therefore is the goal to fill all of it? Is the goal to reach a certain number? What's the capacity going to be?
Yeah, I mean, Councilor, it's a somewhat difficult question to answer. What I can tell you is that when the services were there before, I can give you more details. I think there were over 1,000, close to 1,000 beds, but that included the shelter beds, and we're not relocating the shelter beds back over to the island. So again, it's going to depend on what level of services will end up being there. Some step-down services that will be there might end up being facilities that have 40 to 50 beds, but we're also, again, focused on the long term. So we anticipate that some of the services that will be there won't necessarily just be treatment services. So as we're trying to gather all that information, we're going to realize that the bed number is going to change depending on what we end up getting licensed out there and what we're able to do. As we're thinking about the future, it's not surprising, it won't be surprising to anyone here, detox facilities and access to them is generally accessible, and it's those next level of services that are supportive services that are less accessible, and so those are the beds we're likely to see, but we don't have a number as of today. It will really depend on what ends up being the direct level of services that we want to put out on the island.
And if we think about the island being a certain area, I don't know, what is the acreage out there?
I don't know.
I don't know the acreage. We can get that for you.
Okay, well, if out of that land mass, what percentage of it will be used for? Is the whole thing going to be used for continuum of care services and supportive services? Is there any plan to think about some piece of it for other types of either development or city services or anything else?
Well, I can tell you, I can sort of give you an update. There's other things on the island today. There's Camp Harborview, as everyone knows, a camp for Bostonian youth that are there today. There's also a small farm that's out there today that the Health Commission, I think Be Good, for example, runs that farm. So there's already use and no intended use to not have that farm still there. And then we definitely want to prioritize and think about open space. There are some other uses currently on the island, other uses that are happening today that we don't plan to move. So the whole island itself, again, it would be thinking about the footprint of those buildings. To be frank, and I don't want to, Tricia can speak to this better than I can, some of the buildings need tender, loving care, and so it's likely that footprint will stay, and some of those buildings need a bulldoze, probably, right?
Probably,
So we can't say whether or not that will be there again, but I think what we're trying to do is ensure that we look at the need, look at the continuum, but also understand that this is, precious land, and we have open space, and so how do we think about that as part of this equation as well. So that's the intention as of right now, and that's what we're focused on.
So no portion of it will go to any sort of private development or disposition?
Currently, we're working on the creation of that campus, and that's been the only focus of the administration at this point.
Okay. And this is land that is owned by a particular department, or I'm just curious, because as we're going through other surplus processes with the council, I know Public Works has stuff coming in, and D&D sometimes has stuff coming in. Is this under the Health Commission?
So BPHC owns the buildings.
Yeah.
I think that we'll get back to you on the specifics. I
Okay.
think maybe D&D who owns the specific.
Got it. But if there were any conversation about disposition, it would have to go through similar processes with the council.
Right. Yes.
Okay. And what do you anticipate will be the change to, or the impact on the Mass and Cass sort of Recovery Road, New Market area after all of this is set up?
Yeah, I mean, it's all interconnected, right? I mean, the continuum care is folks who are not yet even accessing care, right? And so I think it's trying to make sure that we create eliminate barriers, the easiest accessible, the most accessible level of care possible on the island. I think what we see in Mass and Cass, and it's a very complex what we're seeing there, but we see that there's many folks who are not even yet ready for care. And so the direct link to Long Island isn't going to be there. But we also see folks, I would suggest in Mass and Cass, who are folks who may have been in care at some point, but that next level of care wasn't accessible to them. And so they've gone back to sort of what's happening in their lives and some of those challenges. And so what we hope to see is that when folks are able to start that process, that we have beds accessible for them to continue down that path. And so we do think we'll see more folks engaged in care, more opportunities to not only get treatment, but get additional supports around recovery, because we know it's just not about medical support or medical treatment. So it's all connected and linked, but I don't want to create this false sense that the creation of the campus eliminates the challenges at Mass and Cass, because that's not true. But again, we need more services, and that's part of one of the challenges we're seeing there.
And so sitting in this moment now, obviously there's a lot of planning and community discussion left to go, but how would you define, let's say, 5 years down the line when everything's up and running, what will you consider success in terms of what the city is doing now and either the neighborhood impacts around Mass and Cass with the opioid crisis across the city and or number of people served and how they're being served?
I mean, success is really making sure that when folks are at that moment, that they're ready to get the support they need to build a healthier life, that we have the accessible service to provide them. And today, that is not the case. There are folks who cannot get to that next level of service. So success for Long Island, well, we have intentionally created a campus where we've had this precious land, and that the programs and services there communicate with each other, and that it is meeting the gaps that are being identified with this epidemic. And 5 years from now, the epidemic could look different than it does today. And so I also believe success will be that we've created a flexible enough continuum that we can also adapt to the growing needs or challenges that might surface from this epidemic. So that will really be success. I mean, we need to give people every opportunity to get healthy, and we're trying to do that as having the island be part of the tools that we're using.
Great, thank you. Thank you.
Thank you. Councilor Flynn.
Thank you. Thank you, Madam Chair. Thank you, Chief Martinez, for your presentation, and I know you're doing excellent work here. Chief, I was wondering, as I mentioned earlier, from my experience as a probation officer, more than half of the people I had on probation at Suffolk Superior were living outside of Boston at the time of their arrest. They came to Boston because of its compassion for people that needed housing or for drug treatment programs. And I was wondering, is there some type of way to engage Greater Boston or the state itself in terms of raising money to ask communities and towns across Massachusetts if they would contribute to the problem we have here in Boston? It's not just a Boston problem, it's a state problem, it's a New England problem, people coming from all over New England to Boston. But is there a way for us to at least consider asking cities and towns across the state to be more active, more engaged in paying their fair share?
Absolutely. I mean, I think part of the work that the Mayor's Office of Recovery Services under Jen Tracy's leadership, part of the work they've been trying to do is engage providers, community groups, but also the state in this exact conversation. You know, we're a regional hub, again, for services, well, not just in recovery and treatment, but in other places. And so I don't think we shy away from that. I think Boston is willing to say that, you know, if people need their needs met and need to become healthy and they're here, we're going to help them. But we also need the state partnership to do that. And it means more services in other places across the state. I mean, people aren't coming from Fitchburg to Mass Ave or Maniacas because they want to, and it's a destination. They're coming there many times for a variety of different circumstances. But one of it is because there's lots of treatment programs there. There's lots of services. There's lots of opportunities to get help. And so if we had more of those services in other places across the state, that would help with some of the challenges that we're experiencing. We're also leaning into philanthropy. We've done a lot of work in the city, Mobile Sharps team, the Engagement Center, outreach workers. We've done a lot of different things within the Health Commission, and we've really asked philanthropy to get involved and help us as well. But of course, this is a regional issue, and so, you know, we welcome suggestions from the council and help to think about how to encourage not only the state, but other cities and towns to get involved in the way that we're taking it on. And the one thing I don't want to leave is other cities and towns are doing things too, and so I don't want to lose that we're the only ones, but the heavy burden is here. And so we need to have stronger partnerships so that they can engage and also support the work. And that's why supporting the bridge and supporting Long Island and the campus is one really positive way that they can get involved to help us make it happen.
Thank you, Chief. That's all I have.
Thank you, Councilor Flynn. Councilor Siomo.
Thank you. Refresh my memory, please, on about how long will it take from the day you get the permit to finishing the bridge?
2 years, roughly 2 years.
2+ years. And Chief Martinez, you're working on the master plan for what the campus looks like, which is going to drive what the buildings look like and the infrastructure. Just wondering, like, the coordination, you know, we can't get on the island for 2 years, but can we coordinate it so that it kind of all comes together in a coordinated fashion, I guess?
Yeah, so I'll just offer a little bit, and then I'm going to turn to you, Trish. Yeah, I mean, the notion is that we want to be able to have 2 phases, meaning that some buildings, again, might need some tender loving care, and so they need less support or less development or less resources, and we may be able to have some programs and services there. So it is our intention to cut the ribbon on the bridge to some services already. How we will build that and do that, Tricia can mention that to you. But so the intention is to have a master plan, but part of that master plan to be a first phase that will be some services that will be ready to go to meet that demand, because we don't really want to wait 3 years, right? We need them today. And then the second will be once the bridge is open, then we'll be able to construct and develop the rest that we need to do. So go ahead.
Just a quick one.
Yeah.
Would it be fair to say that maybe the first phase would be outpatient? Or are we looking for residential right away too?
I wouldn't want to say that the first phase would be outpatient. I think the first phase for us is going to be where is the low-hanging fruit in terms of the building fit. Like if there are these 2 or 3 structures that are ready for these kinds of services and that need is consistent with the vision, then that's what would be there first. So I wouldn't want to lean in on a specific level just yet. Did you wanna-
I would simply add that there's a tremendous amount of coordination going on between the 3 teams, and the ideal, the goal eventually will be, what can we have over there when the bridge is open? And so we will work toward that first phase, as Chief Martinez said, being whatever it is we can accomplish, and whatever services are of value to have there as quickly as we can. So it may not be sort of a permanent solution. It may be a first phase, and there may be other things that happen. Ultimately, the campus will be built as a phased sort of well, not even renovation, as a phased plan, I should say. So, so that is being developed as we're moving forward.
Right, and then, so we have no idea, cost estimates, obviously, at this time for what is required, which will take more capital dollars to deal with the infrastructure buildings and programs once the master plan is complete, and then the hope is to implement the master plan.
I think we're hoping by the end of the year to have some sense of the building system needs, at least. The heating systems, the plumbing, the electrical systems, those types of improvements that will be needed in order to have anything occupied by the time the bridge is built. So we'll start to be able to build those costs. Once we combine that in with the programming, we'll start to have a better sense of the overall recovery campus
So we'll
costs.
probably have some kind of request for appropriation for work that you want to get done in the next fiscal year at the very latest.
That's the goal.
Okay.
That is definitely a goal.
Thank you.
Thank you.
Great. Councilor Baker.
Thank you, Madam Chair. So Trish, the end of this year, you'll have your inventory done, a sense of what the buildings look like, and then Marty, part of this vision, do we envision maybe building more buildings out there or are we?
Well, it's hard to say until that process is complete to know what's usable and what isn't and what needs support, so it's hard to say. Because as you know, there are quite a few buildings out there that held a lot of services before.
Yeah, and the focus groups that you talked about, is there any, like from North Shore and South Shore, is there any commonality in the theme coming from them? Like, what are the big asks? What are they asking for in the surrounding communities?
Yeah, I mean, they're saying, let's take advantage of the fact that we're gonna locate all these services in one central place and let's think about, is there, I'll just lift up a couple examples. Is there potentially a way to ensure that if a person needs this service, and this service, it's all in the same location? It's all, any barriers to eliminate people falling out of service. We have the opportunity to do this on this island, right? We've heard folks say that we need different layers of supportive housing. That folks, one of the challenges when people get out of treatment is that they're not ready to go it on their own, but they need this level of supportive housing, and there's not enough of that in the community. So people then fall out of that, or maybe end up in sober homes or other places that may not be the right fit for them.
Yeah.
So there's been some of those gaps, and one other thing I'll just offer is I think folks have been clear that recovery is just not about treatment programs.
Yeah.
And so there needs to be another layer of support. We have the ability to do that on the island. And so how do we ensure that that's a part of it? So the themes, you won't be shocked. The themes weren't shocking to us. But again, we want to collect as much feedback as we can.
I'd be interested to see if there was an opportunity for housing out there, the transitional type housing, 2 years or whatever, but then how do we move those people if you're a year in sobriety and you should be going to working, how are we going to move those people? So some of those challenges. But I like the way you answered Council Wu when we were measuring success. I would measure success, anybody that's able, excuse me, to leave that island after a year and say that they're alcohol and drug free for a year, and if we could say that without them being on methadone and Suboxone, that would even be another check plus for me. But Chris, will you talk a little bit about the negative water condition that Quincy gave us? What was their basis?
Sure. So there was a couple things which they noted. One is actually related to Councilor Essaibi-George's question around the structural integrity of the piers. They had said they wanted additional information around the structural integrity of the piers. We actually provided that information in July. We provided it again in August. We had our consultants from SDV and TRC there on September 5th to answer additional questions for the Quincy Conservation Commission, but they issued their negative order of conditions, citing that as one of the pieces of information which they want. They still want additional information on. They also noted some additional things that are actually out of scope from the actual project. They raised the issue of the use of cofferdams for work on the piers. We're not using cofferdams.
What are cofferdams?
Cofferdams is a way of doing work around a pier.
If you're building a brand new pier, councillor, we need to sort of keep the water away.
All right.
So that is applicable if I was tearing that whole pier down and
Yeah.
putting something, but we are not doing that.
Okay.
So therefore you don't need one.
Exactly. They
Okay.
also, there was a note about the Moon Island Causeway. The Moon Island Causeway is actually not part of this project. So there were a couple of things which were raised in that negative order of conditions, which are either information that we've already provided or not specific to the actual project that we're focused on, and consequently, we feel confident that in the appeal process that we'll be able to move forward.
Okay. And some of the things that I heard in Quincy meetings was access to the island for Quincy residents and things like they were unable to see the tall ships in 84 or something like that. Are we in real discussions with Quincy about access for the surrounding community? And for that matter, so could any of us here access the island if we ended up out there? Are we having those discussions?
So there's been a number of conversations between our mayor's office and the Quincy mayor's office, certainly ongoing. We did hear, particularly in that June 6th Quincy Conservation Commission hearing, some of those interests from residents in Quincy. I would say that our focus, though, right now really is, as Chief Martinez said, about creating that regional recovery campus, and so that's really what we're focused on with the
And once we
Wellness
have
Bridge.
that footprint, we can potentially figure other things out. And my last question, Trish, who when you talked about coordinating teams, who's on your team heading this up? Like who your
Our
main-
project manager is Maureen Anderson,
Okay.
who's our best planner on staff, for sure.
Okay. Thank you.
Thank you, Councilor Baker. Councilor Campbell.
Thank you, Councilor Essaibi-George, and thank you guys, and also thank you to the Health Commission team and Jen from the Office of Recovery who are here. Thank you guys for your work. Just a quick some follow-up questions. The website that was mentioned to sort of keep people informed, that's not up and running yet. At some point, the plan is to roll this out when there's a master plan. What's the timeline in terms of the website idea, which I think is wonderful?
It is actually live now. So
great.
boston.gov/Long Island. And our intention, though, is to build it out over time with additional information, again, about the overall sort of plan for the recovery campus, the buildings, as well as the bridge project.
And the RFI that will go out, asking people to give us their feedback information will go through that.
Yep, we'll go
Awesome.
through the website.
Are there going to be other ways in which to solicit community input into the planning process besides RFI?
So we've done a variety of different, we've done those focus groups, we've done key informant interviews, we have a long list of providers, the providers who were on the campus before, we've gone into the recovery community. The RFI is meant to be that broad scope so that anyone and everyone who wants to weigh in, and we welcome the opportunity for you all, for counselors to send it to constituents and community groups, because we really do want to hear from as many as we can. So that's the main next mechanism, but as you know well, if people have thoughts and ideas and want to reach into myself or the recovery services team, we'd be glad to hear from more folks.
And do we know when this week it will be released?
The plan is to have it released tomorrow.
Awesome. And then just looking at the timeline for the bridge overall, permits are issued 2 years after that. The bridge goes sort of up. I'm assuming, and I'd never like to assume, that that's the fastest we can reconstruct this.
Yes.
To sail, this is 3,300 feet long bridge. It's kind of long. And we sort of thought of every conceivable scenario of how to do this. 2 years is also an extremely aggressive schedule. But I think the need for this bridge is well spoken over here. So time is of the essence to us to produce this product so that Chief Martinez and others can do their thing.
No, that's very helpful. Obviously, for folks who either need services or those who want to make sure that people are getting services, 2 years seems like a very long time. So in the meantime, what's our plan before we get this bridge rebuilt in terms of capacity, those gaps, addressing those gaps in services, meeting the needs not only of the folks we see who need the services, but also meeting the needs of the other folks who are dealing with who are not equipped, but like our business community and others are not equipped to respond, but who are facing this every single day because it's in their backyard. So what's our plan in the meantime for the next 2 years?
Yeah, so I can weigh in. In the meantime, our plan is to do kind of 3 buckets. One, double down on what we've been doing. Outreach workers, supporting peer leadership programs for folks to engage folks who have been in recovery, greater investment within sort of our city departments, whether it's the fire department, EMS, the health commission. You know, we've done a lot. We've invested a lot with your support and through the mayor's leadership, and so we need to continue to do that. Looking at how effective the engagement center is, some of the issues that we continue to see about getting people into care. The second bucket is really partnering with the state. Most of these services, if not all of them, are licensed through the state, and so it's really how does the state make their investments, how do they lift up opportunities, and so again, through the leadership of Jen Tracy and the Mayor's Office of Recovery Services, really partnering with state partners and CBOs and providers to identify what those gaps might be, and that also includes asking philanthropy to be more involved and to sort of provide more resources in that second bucket. And then the third I would suggest is really focused on how do we ensure, and this is being part of the plan, how do we ensure that no one gets left behind? Because when epidemics come, when you know, diseases like this come, sometimes we look at one population, and as we start to see things change, we're not able to shift and able to understand where we're at. So we are constantly looking at the data and constantly looking at the gaps and trying to lift up and raise those opportunities. I'll give you a gap or a challenge that came up. Many probably saw that recently there was a spike in HIV infections in Lawrence and Lowell, really connected to the epidemic, really connected to intravenous drug use. And so that they discovered the information, what happened, who was affected, and now we've been having conversations here, the Health Commission, my office and the Mayor's office, to really understand what can we do to counter what could come in front of us in terms of a spike in HIV infection rates. And so again, we're trying to, that third bucket is really, we got to be nimble, we got to be responsive, and we have to make sure that as the epidemic opens up a new door, a new challenge, that we walk through it with resources and not be afraid to talk about the things we need to do to improve it. So those are the 3 buckets. We're going to keep working those buckets to sort of close that gap and make sure people can get into care. Unfortunately, we as a city, we run some programming, but we don't have the oversight of all those services. It really comes from the state. So that's part of why we're continuing that advocacy to increase the resources and to partner with those providers doing the work.
So just on the epidemic, I know that that's one reason Sheriff Tompkins had to pull his folks back who were volunteering to clean up that area.
Yep.
And I think was a point of frustration for him, and he was calling us to say, I can't keep sending my folks out because of some of these hazards that were being mentioned in Lawrence and others. So thank you for the update regarding those conversations. Understanding that the state has to step up more, and we've been talking about that, and the need, frankly, for other municipalities to step up, which I have a couple of questions related to that, and asking them what is their input. It's one thing to have conversations with them, focus groups, and them say, your plan is to rebuild this. The question I have is, where's your money, your human capital, and everything else to contribute to this? So understanding that context and the need for more resources, if we have a plan to close these gaps and a plan to cover these 2 years or 2 years or more before this bridge is actually rebuilt, what's the overall cost for that? So when we talk about closing the gap, how much is that? You know, what would the providers say? I don't know. What would the state say? Pulling all this together, is it $100 million? Is it $200 million? Is it more than that? because I think that helps us, at least on the council side, understand how much we need to be advocating or putting within our council budget. Also, what we should be asking other municipalities to be contributing, how we force their hand a little bit, given that we are addressing a lot of this for constituents who don't necessarily live in the city of Boston. And of course, we don't want to turn people away, but we want everyone to contribute their fair share. So I'm curious as to what the cost or the price tag would be for those sort of three buckets that you have to deal with.
We'd be glad to sort of look at kind of a number for you. I mean, I think the reality is that, you know, there's so much that we can do, but there's also there's a policy side to all of this, right? It's about how accessible is it, what's reimbursable, what isn't, how does insurance play itself out in this work, and how, you know, when we think about things in terms of providers doing certain programming. You know, you have CBOs, some of which are here, who have to make a decision to not provide that level of bed because it doesn't get reimbursed at a rate that's going to allow them to actually make it feasible. So again, the cost is the cost is something we can talk through and try to give you some an estimate. But I stress to you that there are many levers on this problem, and the city is one, and there are lots of other places where we need to sort of apply pressure, which is also why the Mayor's Office of Recovery Services is doing policy work and thinking partnerships and regionally so that we can better understand what's happening in other places. I take homelessness, for example, as just on a subset. When we talk about homelessness, we have to think, you know, you might be homeless in Boston today, but you're homeless in Cambridge tomorrow. And so we have to be thinking about that in a regional place and who's doing what in which city. We're trying to do that today while responding, as you all know, to the day-to-day issues in neighborhoods. So we're doing a combination of those things, but be glad to sort of think about what's that cost that we're taking on and try to provide a number that might be helpful for you to look at.
And I only ask or try to get more detail because when we're out and about talking to various folks, including folks from other municipalities, or as in a meeting with MAPC, they do the Metro Mayor's meeting, and we know our mayor participates in these regional conversations related to the opioid crisis. And my question is, well, what's coming out of those conversations? What are the mayors agreeing to do? Does our mayor feel like he's on this, you know, out here on his own? What are the asks? And so it would help us to have a better sense of not only what the plan is to close the gap in these couple of years while we wait the rebuilding of the bridge, but also what the price tag is. And I'm not confident, frankly, that the state is suddenly going to step up overnight. It may not happen. This may mean that we have to shoulder more than we like. And you know, that's terrible to say, but it is what it is, right? But at least if we have a sense of what the landscape is in terms of the price tag, I think it allows us to come together more as a collective to push other municipalities, the state, philanthropy and other places in partnership with you guys to get the very things we need. Lastly, my question was just on the $108 million. So can we break that down again? So about 80 million or so we approved in the last budget.
Correct. So if you, go ahead, I'm sorry.
Yep, go ahead, Chief.
So if you look in the budget book, the number you will see is 108. Some of that money, though, is for work that has already been done related to the previous superstructure that is there. So our actual bridge estimate for the new superstructure going forward is roughly $90 million. Most of that $90 million comes from something that you'll see in FY19, which is a new authorization of $80 million. That is the $50 million of general obligation funding, $30 million of parking meter funding. Was that, I don't know, that might, I mean, that's essentially the rough breakdown. So.
And
Chief,
is any of that, go ahead.
Sorry, I'm so sorry.
No, don't
If I
be.
can add, so in our budget books, it shows the total amount of monies for the Long Island Bridge from the time it became a situation, which was in 2014. So the first 20 million, Councillor, which we spent was to take the superstructure out. So that's 20. So there's another about 80 to build, to put this thing back. It's like Humpty Dumpty. Okay, sorry, put the bridge back. And about another 8 to spend on the brain power, the consultants to put it together. So that's how the 108 comes.
Does this also cover any of, Trish, your costs, your department's costs?
This is bridge.
Okay, so what is that costing you in terms of going out to assess the current existing conditions and all of that to give us a report by the end of the year as to what's happening out there?
So right now, we have a contract with Hacks Engineering, which is a consulting firm, and they have full complement of consultants and engineers for the various disciplines. The contract amount right now is about $432,000.
And this is my last question. Quincy, how long is this appeal going to take? And if Quincy keeps appealing, or if Quincy just frankly never comes to the table and is like, I am standing against this to the very end, what does that do in terms of our timeline, and what does it do in terms of the overall project itself of reconstructing the bridge?
Yep. So we start the appeal process. What triggers the appeal process is the receipt of the written sort of negative order of condition from the Quincy Conservation Commission. We receive that on the 27th. We have to get our appeal back essentially at the local level, at the state level within 10 days, the local level within 60. Overall, again, we feel confident in the approach that we're taking. We think that our approach really is about minimizing the environmental impact and sort of any sort of abutter impacts that reconstructing this superstructure will have. That's why we think we will be successful in the appeal process. And yes, our timeline is aggressive, but because of the importance of what we're trying to get done, we are moving forward as fast as we can. It's been actually very helpful for us, I think, to have a number of conversations with Quincy. There are very open sort of channels of communication there, and we're hopeful that we're able to work with them going forward as well.
And if we can't? Worst case scenario, just so no one's surprised.
Yep.
I'm not saying that that will actually be it, but it's a question that some constituents obviously ask, even if they don't pay attention to these hearings. They read the newspaper, and they're concerned if Quincy doesn't step up, what does that mean for our plans in the city of Boston?
So the appeal for the Quincy Conservation Commission for their state ordinance is to Mass DEP, and there's a appeal at the local level to the courts. We'll basically be working with sort of taking our appeals to both those bodies, and we will be doing that, frankly, as quickly as we possibly can over the next 10 and 60 days. And our hope is that we will be successful. And again, I think we are confident that both the DEP and the courts will support our appeal process and allow this project to go forward.
If Quincy says no, can this bridge be built?
So there's always a point of appeal, but we just need the group that we're appealing to allow us to be able to go forward.
If we lose all the appeals and Quincy says no, can this bridge be built?
If ultimately we lose our appeals, then it will be hard for us to move forward. Yes, we won't be able to go forward.
We'll keep advocating with you guys. Thank you very much.
Thank you.
Thank you. Councilor O'Malley.
Thank you, Madam Chair. Thank you all for this very, very thorough overview. I was just on the website, boston.gov/Long Island. I'll be tweeting it out. It's a very well done and dense site, which is great because I think that we're all committed to sharing as much information as we can. I want to sort of talk briefly so my colleagues can go on sort of a best case scenario and then some more process oriented questions. Yeah. So best case scenario, it's 2 years from now. It's open, bridge is great, $90 million on time, on budget, under budget, or hopefully. You talk about how the recovery services would be expanded for harm reduction, detox, residential treatment, transitional housing, ongoing peer support. That's from the website. So briefly, just give me like 1 or 2 sentences what that means. Harm reduction, for example. What do you mean by that?
So harm reduction, the bucket of services, it means meeting clients where they're at. Yep. So it could be a variety of different kinds of services. Harm reduction services here include, folks who are users and trying to get them into service, and we have needle exchange and things like that here that we wouldn't do there. But it's just that bucket of harm reduction services.
Does it include safe injection facilities?
It does not include safe injection facilities.
Is it something that you're looking at, the mayor's looking at?
So currently, as folks
I know there are none in the United States, but...
Yep, currently, as folks know, the mayor has been asked by the state to sit on a commission that he advocated to be created to do a study on safe injection sites. Okay. And so we're studying it today and providing him information, and he's charged us in the Office of Recovery Services and HHS to better understand the impact of safe injection sites in communities and in neighborhoods. I think obviously, it's part of this larger continuum, but understanding how it would fit is a much larger question.
Okay, yeah, and that's I don't want to get into specifics, but that's helpful information. Detox, it's pretty self-explanatory. Yep. Residential treatment, so that was to Councilor Baker's point, where he's calling for, as well as the next line, transitional housing. Talk a little bit about, do you have any? Is it too early to put numbers in place in terms of the number of spots, or can you just give me 1 or 2 sentences on sort of residential treatment and transitional housing?
It is too early to put numbers in place, but what I will say is that one of the paths to keep people in treatment is to give them supportive housing support. So that will likely be part of the scenario. We hear time and time again that that's why people fall out of treatment or
Yeah,
fall out of recovery.
no question.
Yeah.
No, I think that is probably the most, among the most impactful things we ought to be looking at here for this to truly be a success. And then peer support, I assume that's similar, very similar to harm reduction, but can you talk a little bit about how that would be different in this expanded services?
Yeah, likely. I mean, one of the things we heard through the focus groups is that folks, being engaged within the recovery community is an important part of the work. So someone who's been there, who's been through it, is very supportive and can help keep someone through their process.
Yep.
So we want to make sure that although you might be in Long Island and away from the city of Boston, that the community is still engaged and connected. So peer-to-peer programs are really important today, and we'll do our best to ensure that there may be that opportunity to still have that on Long Island, even though there'll be a little bit of distance.
Great. Chief Osgood, you talked a little bit about how it will be environmentally sustainable and addressing the fact it is an island. We are dealing with climate change. Can you talk a little bit more about that and in terms of how we can make it as sort of, during the construction process, it sounds to me that there would be a real opportunity to maybe invest in some renewable energy infrastructure. I'm talking about wind turbines, for example, while it's being built that could both serve the campus as well as serve other Bostonians. Can you talk a little bit about what you have in mind?
Yep. So the sort of sustainability efforts and the environmental efforts, and Park can give many more of the details, are really specific to the bridge themselves.
Yep.
So in terms of sustainability, it's really about how we treat the piers and ensuring that we are thinking about sea level rise and sort of raising where the pier cap in the base of the superstructure. In terms of making it more environmentally friendly, it's really about how we treat stormwater runoff. So rather than having stormwater runoff from the road drain straight to the harbor, it's about treating it before it actually gets there. We think that our overall approach is a sound environmental one, and we think that's, again, why MEPA earlier, at the end of last month, basically said that we can go forward and issue the certificate on the notice of project change. In terms of looking at other components to the island, in terms of renewable energy and other things like that, that has not been part of our efforts so far, either thinking about the bridge or about the campus, although I would defer to Trish on that. But happy to sort of entertain any notions of other ways which might be able to make this a more environmentally friendly project.
Yeah, no, that's very helpful. Again, and I want to be clear on what the mission is here, and I don't want to bring you guys too far afield. However, I think there is an enormous opportunity as it relates to building wind turbines, solar PV farms, as the construction is happening, that could both service the campus and provide an impact for the rest of the city. So I'll be continuing to push that. Okay, and then the DEP sent a favorable letter you just referenced in the Quincy. I won't belabor the point, but the Quincy Conservation Commission sent a letter, or was this the city of Quincy sent a letter of denial last month?
So it's the Quincy Conservation Commission sent a negative order of conditions. That was on our notice of intent. That is essentially them denying our notice of intent at the Quincy Conservation Commission for the reasons which we had sort of discussed previously.
Yeah.
It is that which we will then be appealing shortly.
Okay. Well, again, I appreciate that. I understand the political sort of. I won't say I agree with it. I certainly understand why at a similar hearing not too long ago we had the Norfolk County District Attorney, who happens to be in a butter, list the reasons why he was against this. And quite frankly, I thought it was NIMBYism at its worst. So I know I've talked to some friends, some colleagues in government in Quincy and elsewhere who recognize that this is going to serve all residents, not just Bostonians, not just residents of Quincy. So I certainly would just reiterate my support for this completed project and the people, more importantly, whom it will serve. So thank you. Thank you, Madam Chair.
Thank you, Councilor. My question really goes back to the point of Quincy. You know, as of last week, the Quincy mayor asked the city council for another $250,000, $250,000 to hire more lawyers to fight. So we can talk about the campus, we can talk about the bridge, we can talk about anything, but until Quincy, until we finish where we started, if we don't get permission, there's an issue. So, you know, we've heard from the beginning you could take the bridge down, you could do ferries, you can do boats, you can do all these other things for umpteenth money. I don't even know how much the ferries and all would cost. I've heard that medically you couldn't do it because of you need nurses on board and all kinds of other stuff. Can you just, to the Councilor Campbell's point, if you could just explain better the timetable of these appeals? Yep. Because I'm not a lawyer, and nor did I ever want to be one. But it's very vague, and I know that nothing happens fast in the world of justice. So, can you just give me a timetable on how that would be and how that would negatively or positively affect how we move forward?
Sure. And Par may have some additional details on the actual timing, but the appeal process sort of now starts that we've got the negative order of conditions from Quincy. There is a sort of 10-day window to appeal at the state level. That appeal is to DEP. There's a 60-day window to be able to appeal their local wetlands ordinance, negative orders of condition. That happens to the courts. That process, we will be moving quickly on this effort, and our hope is that over the course of this year that all these pieces are indeed resolved. We do feel very confident in the actual project that we have. Again, it was good to be affirmed by MIPA earlier, at the end of last month. So we think that the approach that we're taking is really being recognized as an approach that really minimizes environmental impact, minimizes the impact during construction for any abutters in Quincy as well as anywhere else. And so we're confident in this process going forward.
Okay. But there's no doubt it's concerning that the mayor's asking for more DOTA to stop the project.
Yeah, which is why, to the Council President's point, sort of your continued collaboration, the collaboration of all the program providers is really important in this.
Yeah, I think it'd be important if we got into the loop a little bit better as well. If their city councilors are ready to cut a check for $250,000, maybe we should be involved a little bit closer with them as well as partners. So, thanks.
Thank you, Madam Chair, and our thanks to Council President Campbell and Councilor Essaibi-George, the makers of this hearing order, and appreciate all of my colleagues. Great line of questioning in our panel's comprehensive responses, so I'll do my best to not have you be too repetitive here. But I did just, many of my questions have already been answered relative to private development, timeline, capacity. I wanted to better understand what sort of auditing we've been doing in the wake of the closing of Long Island. So for those for whom services were disrupted, have we been tracking those folks? And I know, again, we're a benevolent society and we don't want to turn anyone away, but I want to make sure that those that were disrupted and displaced, that they are being prioritized and that we know what has happened to them. And then for those program models that were proven and that were successful, I'm under the impression that at least 2 of those had to shutter their programming entirely. And I'm just curious if we're also keeping track of those programs, again, that were proven models, and what is our commitment in the next 2 years as a contingency plan, but really not even a contingency plan, just to meet the need which continues to grow, to rehouse those programs in community, whether Long Island, how quickly that happens or not.
So what I can say is that absolutely one of the goals of when we had to make the difficult decision to close the bridge was to figure out how do we ensure we don't lose any beds, right? And so on that front, we were able to relocate in partnership with CBOs very quickly and the Health Commission supporting to relocate the services, most of the services that were beds. And that was really about ensuring that we didn't create a gap when this unforeseen circumstance was created. I think the reality is that since when the bridge was closed to today, the epidemic's gotten worse, there's no question. And so we've seen more overdoses, more deaths, we've seen more investment, more resources necessary in order to meet that demand. So one of the things that not only did we replace the beds, but we increased the capacity in partnership with not only our Health Commission, but in partnership with the state. Some services did go away that were not actually residential services, but some services did go away. But what we have tried to do is make sure that all the providers who were there at Long Island before have had a voice in this process. So we've reached out to them. We have gotten information from victory programs and even the shelters who were there, just to understand what are the services that were there that they were providing, and how do we make sure that we bring those best practices with us. And to be frank, Counselor, what wasn't working? And they were very honest about what wasn't working.
And that's a perfect segue.
Yeah.
Because I do also feel that because we are so desperate,
Yeah.
that at times what was happening at Long Island was being romanticized. Because when you spoke to people that were on the island, there were a lot of challenges. And so I just want to make sure that there is a postmortem and an audit that is engaging those who were in services, who lived on the island. So things like, you know, making sure that the services are trauma sensitive and informed, culturally competent, that we were considering those that had jobs, and the curfew whereby they had to return was not consistent with folks working and also getting to the island. To your point, Chief, around new HIV infections, what we see is an increase, I think, 15 to 19-year-olds and 20 to 24-year-olds. So people are using much earlier and then engaging in other high-risk behavior. And I see this especially a growing number, a demographic fastly growing in young men of color. And so I just want to make sure that as we have an opportunity to reset, that those who have benefited from those services have the opportunity to have their voices heard, and that we are honoring that in the new system. So for example, is there an age requirement? I mean, the thing that I hear from so many youth that are either battling substance abuse disorders or experiencing homelessness, that there isn't a place for them where they feel safe. So how do we, if this is the fastest growing number and they're the most at risk, how are we supporting them?
So there's no question there's a gap in services for young people, adolescents, age. There's not enough services currently, and some of our partners who are providing services to different populations will raise that up. And it's a conversation we've been having. Clearly there is a need to figure out what those services look like. So there won't be a limit on age in terms of what could be out there. It's really going to be about those gaps and how do we try to fill those gaps. So clearly understanding how to meet the needs of an 18-year-old who's had this experience and who's struggling with these challenges. Just because you know the work doesn't mean you know how to do it with an 18-year-old and to serve them adequately. So that's part of what we're trying to figure out in terms of those services. The one thing I just want to speak to that you mentioned is that, you know, there's no possible way that we can just recreate what was there and not assess what was there. So we have to do that, and that's what we're doing. And even if it means having tough conversations with someone who maybe ran a program there for a long time, but maybe that's not the kind of service that we want to go back there, that's what we're doing as the Chief of Health and Human Services. That's the work that I think I'm charged with leading. And so I want to make sure that what we put there not only has those other layers in place, but I would also argue thinking about the cultural competency of providers and the services they provide, and ensuring that they have the ability to meet the face of the epidemic. So we're doing that work and welcome input from folks. Many of the folks doing this work, including folks from our Recovery Services Office, have worked on the island and knew services that were there, and understand where there were some great strengths, but also where some of the challenges were.
And then just two other quick points. So earlier today, I was participating in a conference called Healing the Healers, right? You know, prioritizing self-care for those who do this work.
I missed you. I was there after you.
Okay. And so you know where I'm going. So I do, and you and I, you know, are of aligned minds on this, and this is work that is slowly beginning to happen in more and more of these spaces, and it needs to. So I want to be very clear that when I talk about supportive services and wraparound, not only talking about how do we make sure providers can best serve those that are in need, but how are we supporting providers? And some of that might be about capacity and bandwidth, right? And so just two other things on that. So I just wanted to, you know, bring that into this space and make sure that's a priority as well. And the gender piece, I'm always bringing this up. I don't know what our current data is, but at one point, you know, for every 8 beds available for a man, there was only 1 available for a woman. So I just want to make sure that we are being mindful of those, not only those age deficits or gaps that need to be addressed, but that we continue to see gender disparity when it comes to services. And then back on staffing and bandwidth, and this will be my last point for now. Appreciate very much Councilor Campbell's line of questioning on wanting to be very granular about the role of the state and other municipalities. I wanted to get clearer on our responsibility, not only in pushing for greater collaboration and greater investment regionally, but what more do we need to be doing? So from the standpoint of the Office of Recovery, what sort of support do we need there to increase capacity there and to support that programming? I don't recall right now. I think is the last budget for the Office of Recovery Services might have been $400,000.
I can give you the exact number. I can get it to you.
Well, it doesn't seem to be enough.
It's roughly in that area, yeah.
Definitely not enough. So
Yeah.
if there's any magic number that you need our collective
Yeah.
support to be lobbying for the Office of Recovery across other agencies.
The only thing that I would add to that, Councilor, and I think it's important, the capacity issue is important, but I think it's, and anyone that's working in the city knows this, that I'm trying to make sure people realize it's not just the Office of Recovery Services who needs to tackle this work. We need all of our city departments to understand the role they play, because that's critically important. So when we're thinking about investments, we want to make sure that what EMS and streets and public safety and public works, because again, these issues dig very deep. And so, again, I think that's a part of that conversation. But I think what the Office of Recovery Services is trying to do, and I think we're looking at a variety of other pieces, but trying to make sure that whatever we're doing, we're thinking about how to share best practices with other cities and towns. So we've done some toolkits, we've done some things, and it sounds, it sounds like it's pretty far removed from the work. But if we know what's working on the streets here in Boston and different places, we want other cities and towns to know that as well, and how to get people engaged and get them into treatment and resources. So of course, more capacity is always necessary, but I just want to broaden it because other city departments need to see themselves in that work as well.
Sure, not centralize the responsibility. Got it. Thank you.
Thank you.
Thank you,
Thank you,
Councilor
Madam
Presley.
Chair.
I'd like to note that we've been joined by Councilor Janey, Councilor Flaherty.
Thank you, Madam Chair, and thank you to the lead sponsors. Good to see everybody, obviously, Pyra, Chris, Marty, and Trish. I'm going to obviously be a little more critical, respectfully, in that we're in a fight. We're in a fight not just with the opioid crisis, but we're in a fight with the city of Quincy. And you guys are here, and you're going to be asking us for tens of millions of dollars. When it's all said and done, it's going to be north of $100 million. And you're here today, and you can't tell us how many beds, you can't tell us the breakdown between male and female, between adult and adolescent, between, basically what types of services from detox to aftercare to wraparound. We can't even ensure the residents and businesses of Roxbury and Dorchester, South End, South Boston, and some of those surrounding communities around Mass and Cass, that when the Long Island campus opens, that fiasco will come to an end. It looks like we're going to try to keep that going and keep the campus going. And I would argue that if folks have the choice to continue to run their program down at Mass and Cass, 3/4 or 80, 90% of them, they're going to continue to do that, despite the fact that we have this state-of-the-art, full-service campus out at Long Island. If you want methadone, you want Suboxone, you need to go out to the island, and that's our opportunity to maybe potentially get treatment and recovery for that individual. But if we're going to spend over $100 million out at Long Island, and we're going to continue to have the chaos over at Mass and Cass, I think that's tremendously disrespectful to the residents of those communities, as well as the businesses who've been working hard, shoulder to shoulder with us to try to fight this problem. So I know you're working on it. I think we need to work quicker. If the mayor of Quincy or the city councilors of Quincy call us, we're going to look pretty stupid when we can't even answer the basic questions of how many beds, what's the breakdown, male to female, adolescent or adult, and what other services, and who are service providers, and what are the partners, and we're just going to do hubba. We're in a fight, and you need allies, and we need answers, because we're going to be authorizing the expenditures, but we also need to know what the program is out there. And this isn't the first hearing on the subject matter. Mayor made an announcement several months ago. This body had a hearing, folks from Quincy come in. And so I guess that's going to be sort of a direct opine, if you will, or some criticism, that we need answers, and we kind of need them yesterday. particularly in this fight. As my colleague alluded to, the city of Quincy they've lawyered up, and they're going to pursue every possible avenue to to block this from happening. But in the meantime, what's our plan? What's our vision? Where is the meat on the bone so that we could advocate as allies as to why this is important, not just for the city, but for all the surrounding communities? And finally, I would like a census. I would like a survey done over at Mass and Cass, respecting HIPAA. I want the towns and the communities that those individuals are from. Of particular concern is Quincy, Squantum, and Howes Neck. And I would probably broaden the circle a little bit to communities that touch Quincy, would say like Milton, Braintree, Weymouth. And I would venture to say that a significant number of the individuals that are over there participating in the activity and or trying to find their way come from those communities. And so when folks from Quincy kind of point to us, say, well, that's your problem, we need to sort of broaden that circle. And as with respect to folks that are going to come into our city and continue, because we're the only one that's doing it. No one else wants to pick up the slack, particularly our suburban counterparts. But maybe we should put a detox or an injection site in one of those neighborhoods. Why does it always fall in Boston? And I think that if we do a census and we do a survey of the individuals that are over there, I think it would open up everyone's eyes to the fact that this isn't a Boston problem. Boston is trying to assist in, arguably a significantly wider geographical problem than I think anyone could even imagine. So that's my 2 cents for the day. I'm asking for a survey and a census as soon as possible so we can have the data as to, where these individuals are from, where their hometowns are from, where they grew up. And also, we really need to, as soon as possible, get more details on the vision and the plan for that campus, particularly if you're going to be asking for the funds and or looking for allies in the fight. And more importantly, the people over there, I can't speak, I know it's Councilor Baker's, it's Councilor Baker's district, and I think it's also abuts and it's shared with Councilor Janey, but their phones must ring off the hook from the residents and the businesses over there. We need to bring an end to that fiasco over at Mass and Cass. Clearly, the Long Island campus is the hope for that, but I'm hearing that they're going to both kind of work together. And I would caution you, just having the familiarity and the length of service here, and also my involvement around treatment and recovery. If that option continues to exist, they're not going to go out to the campus. They're not going to do that. They're going to hang at Mass and Cass. That's their option. That's going to continue their program. Versus if you move everything out to the Long Island campus, that's where they're going to go, and that's where our best shot of capturing them and getting them the help and the treatment that they need. So that's that on that. Thank you, Madam Chair, and I'd like to get some comments on when we're going to get some meat on the bone here.
Sure. In terms of the survey, we can work with our outreach workers to figure out how to collect some information. Obviously, people are transient there, and so it's not like it'd be easy to get all the information, but we can try to identify some of it. We know that more than half the folks that are accessing services and our own shelters are not from Boston. Right. So I'm not sure we need the survey to be able to answer that question.
And Chief, I think it's important for us to be able to tell the mayor of Quincy and the city councilors from Quincy that a lot of the individuals over there are from Quincy, they're from Squantum, they're from Howes Neck, and that we're doing the best we can, that we need a partner here. We don't need, an adversary in this fight.
Yeah, absolutely. I'm not sure that giving them the information of how many from Boston are from Quincy are going to prevent them from trying to stop us to build the bridge, but we can create that information or get that for you. I guess in all respect, I think planning a comprehensive recovery campus doesn't happen in 3 months. We have to do our work to better understand the needs and the gaps that exist and to try to mindfully plan for 2 years what will happen to this epidemic. Epidemics and diseases change over the course of time. And so we have to do our due diligence. It may take longer than people like, but we have to understand what really is keeping people sick, what is preventing people from taking advantage of care, how do we close the gaps to make sure that every population, that no one gets lost, that it's not just meant for certain people, but that all people access those resources regardless of what zip code they come from or where they live. And so there's work to be done, and we're doing that work to understand that continuum and to understand the gaps. And to do it in a meaningful, thoughtful way, it has to take time. We are not going to just day dangle some resources and hope that that's enough information to make people feel like there's the meat. I believe that from a public health approach, that we have to do it in a way that is thoughtful, brings in as much information as we can so people have a voice in the process, but make sure that we have what really is going to move the needle. Because we don't want to just create a campus that makes people feel like we did something. We want to create a campus that's actually going to impact the issue. So that's what we're trying to do. We have details that we're working through, but I respectfully want to have the time because I want to hear people's voices, those in the recovery community, those CBOs, those providers, our neighbors. We want to make sure people have an opportunity to weigh in, and that's the process that we're engaged in today. So definitely can give you as much information as we can so that you can join this fight. We had, I think, roughly 900 letters of support into the MEPA process, and I appreciated that, having close to 1,000 letters from providers, including many of you here. So the support is there. We want to continue to build it, but I just want to make sure the counselors know that I want the process to be thorough, and I want us to have the information to do what's actually going to make an impact on the disease.
Great. And what about Mass and Cass when Long Island's open? What are we doing with that?
Yeah, we're gonna continue to do what we're trying to do now, is to tackle this in multiple ways. Just like all of you are getting calls, we're getting those same exact calls. And so trying to tackle those from public safety, from streets, from the recovery services and the health commission. We just now are gonna invest more resources in needle pickup and outreach workers and getting people aligned into the services. I mean, in all respect, Counselor, we're in an epidemic. We have people that are dying and then people that are sick. And so it's not pretty, it's not always what you see. As Councilor Essaibi-George says, there's things we don't see, but we're fighting it on multiple fronts, and we have to continue to do that work. That's where we're at today, and so yes, do we want to make sure that Mass and Cass can be improved? There's some strategies we're taking on, but we really have to make sure that we understand that we're trying to create more opportunities on Long Island so more people can get into care and stay into care and get into that path of recovery. So there's no intention to just leave Mass and Cass the way it is. I assume you know that, and the leadership of the mayor to make sure we do it, but I think we have to really make sure that we're being as mindful as possible to tackle Mass and Cass, and we're meeting on it every week to try to come up with solutions that'll clean up the area, but I don't want to lose the fact that people are there because they're sick.
Thank you. Thank you,
Madam
Councilor
Chair.
Flaherty. Councilor Janey.
Thank you so much, Madam Chair. So I share, I think, the sense of urgency and frustration that you hear from my colleagues, and I certainly appreciate you wanting to be very thorough in your approach, that this is an epidemic, that people are sick. I'm very much interested as a district councilor that represents Roxbury and South End, two neighborhoods that are hit pretty hard by this epidemic, hearing what kind of the overall plan is. So I see the reconstruction of a bridge as being one piece of it, and that's not going to solve all that we see in our neighborhoods. And so, and I'm sorry if you've already kind of covered that, but I'm interested in what kind of the overall plan is beyond the construction of the bridge and the campus.
So working in partnership with the Mayor's Office of Recovery Services and Jen Tracy, we are continuing sort of down a three-pathway sort of strategy, one of which is to double down on the services that we're currently providing. So we've increased the number of outreach workers, we've increased the number of folks on the Mobile Sharps team, increased folks within our PATS and AHOPES program through the Health Commission so that more people can get into treatment and get into care. We've increased our needle exchange program so that more people can access those resources. In specific, Councilor Janey, we've also looked at different neighborhoods, right? So things push out and push into different neighborhoods, and so we've had conversations around, some of the issues in Dudley Square. The mobile caravan is there in Dudley Square, trying to get more people engaged in resources and treatment. We're also working with a variety of other providers to understand what's happening. So that first bucket is to double down on what we've been doing and the work we've been doing. The second is to sort of raise up the need to have more partners at the table and to have better partnership and collaboration, including with our state partners. The state is doing some of its own strategies, but we need to partner with the state to ensure that there's enough services that are accessible and available for all people at all levels. And so we're doing that layer of work as well through the city. And then the third piece is to engage not only the state, but also to engage our philanthropy and other supporters and funders to be able to create more opportunities. As you know, we just released a prevention report. I don't want to lose it. When we have an epidemic, it always started somewhere else. So if we don't concentrate somewhat on prevention, we will just recreate where we're at. So part of that is to bring in, we launched a prevention report, which also says a lot about the issues impacting young people, especially youth of color in our community around substance use. And so there's a variety of strategies in that report that we released, and we've engaged a bunch of funders and philanthropy to sort of get involved in that as well, to tackle that and take that on. And the only other thing I'll notion is, as we're doing all this work, we're really trying to make sure we don't lose the notion that we need this larger plan. Planning Long Island, going through these 3 strategies, and ensuring that we can keep moving and paying attention and move it forward.
And that's what I'm asking about, like
Yep.
a comprehensive, larger
Yep.
plan that isn't just kind of piecemeal. Can I ask some follow-up
Yep.
questions? So you said that you increased the number of outreach workers. That went from what number to?
I'd have to give you the exact number from the Health Commission, but we just literally in the process of increasing 2 more full-time outreach workers right now, which we're in the process of figuring out. But we had increased a certain number to have more on the street, because the reality is the more people can engage on the street, the more likely they are to get them into service or treatment, into different neighborhoods.
Where are they in terms of the neighborhoods?
Right now, the bulk of them, as you can imagine, are Mass Ave and Mania Cass and the surrounding area. But we also have outreach workers into some other neighborhoods. I'd have to give you the specific information from the commission, so I don't misquote what's not actually happening. But we are increasing the street work, the outreach workers, and plan to invest in some of the peer programs. I don't want to lose this. The peer programs are really important. Folks who have been in treatment or been in recovery, should I say, connecting with other folks who are not yet there. That's a really important part. So we've been investing in some CBOs doing that work, and want to continue to expand that so we can have more of that on the ground.
And so what is actually happening? You mentioned earlier the problem moving. You know, when we talk about cleaning up an area, what actually happens. So for example, there's been a lot of attention in Dudley, which I'm grateful for.
Yep.
And it's needed. But it doesn't necessarily mean that people are now well or healthy. Doesn't mean that people suddenly have jobs or homes. So what is it that you're doing or other agencies are doing within the city to really help people rebuild their lives? Like, what is happening so we're not just kind of moving people along? How do we know that we're actually getting people into services that they need?
So let me just clarify about when it moves along. It really is if a street outreach worker is working in certain areas and connecting with people on the street about services or resources or programs. If I'm not there and I don't want to talk to you about that, I go somewhere else, right? So it's not us pushing people into other neighborhoods. It's us saying there are outreach workers here trying to engage around treatment, trying to engage around, hey, you should use clean needles. You should have an opportunity to think about, are there job programs? There's the engagement center. They're doing some training there. When you don't want to hear that message, you're like, I'm going to stay away from this area. I'm going somewhere else because I'm not ready for that message. So what's happening is we're getting people into treatment. We're getting people into care. We've seen hundreds of folks get into treatment through their engagement through the engagement center, who maybe just came in for coffee or just to get out of the weather and then met an outreach worker and then got engaged into treatment. So we see the numbers. We've given out thousands and thousands of clean needles, which are really important to keep people safe and healthy in terms of harm reduction. And to think about infections and HIV and hepatitis and all those things. So we're seeing those pieces as well as the employment piece when we're looking at career pathways programs for folks who are ready. But the reality is, if you're on the street and you're using and you're not ready for an employment program, right? There's other layers of support you need. And so we're trying to help do all those layers of support with our programs and listen to our providers, because the city only provides this much resource. The providers are doing the bulk of that work. So listening to them, what they need and how they need us to support them, and to make sure that we're responding to the epidemic. There's not one strategy, no silver bullet.
Exactly.
It's not something we're not doing. There is no one strategy to this. It's a comprehensive approach. It doesn't always look pretty, but it's comprehensive, and that's what we're trying to do.
No, I appreciate that. You're absolutely right. And I appreciate you highlighting the providers and the work that they're doing. In terms of, though, the numbers, when you talk about the number of needles, you talk about the number of people getting into some sort of support or service, do you have any of that data with you?
I don't have the actual numbers in terms of people in services and needs. I can get it for you. As you meant, we track it on a regular basis, so I can give you the latest numbers of where we're at.
And then in terms of partners like the state, you mentioned the state being a partner in some of this work. Is that also true around the construction of the bridge?
No, that's really a city-led project.
Okay. And other municipalities, no one else kind of chipping in?
Not financially. Obviously, this is a project which goes through a series of review processes, including those of the state with our partners in Quincy, as well as at the federal level, but not financially.
And in terms of the construction of the bridge, what commitments do we have in terms of meeting the goals of the Boston residency job policy, or making sure that MBAs and WBAs are being hired, as well as the goods and services that are needed for the construction of the bridge and the campus?
We will continue to abide by. Sorry, Councillor, we will continue to abide by those city regulations to the best of our abilities to the levels that are practical, by which I mean if there's some extremely highly specialized work that needs to be done, we need to be mindful of it, but we always continue to aspire to all the regulations instituted by the city.
And is it going to be monitored by the BEC, this project?
By the
I believe so, but we'll look back to you on the specifics of that.
Okay. And
Counselor, could I just give you what, do you ask for a number? And I realize I do have one that through our own PATS program that we run through the Health Commission, that particular program is sending about 20 people a day into treatment programs currently. And so that's the number that it's running. I can give you a larger number, the total number, but on average, it's about 20 people a day that are coming in, meeting with a counselor or a case manager and getting placed into a treatment program. Not always in Boston, because many of these treatment programs are not in Boston, but are being then serviced and connected to a treatment program.
And do you also track whether people come back again?
Yep,
or these are new?
They're tracked, and once they're connected to us, they're part of our case management system through the Health Commission, and so we do track that so we know what happens to them, because we want to keep them engaged long-term, not just a one-off.
Yep. And then final and somewhat unrelated, but certainly connected to the overall, when we're talking about recovery services, is Shattuck. Could you give just a quick 3-minute of what is or isn't with Shattuck? So there are a lot of questions and concerns that I'm getting from constituents in my district around the plans for Shattuck. Could you just tell us?
I'll give you the 60 seconds because that's what I have about the Shattuck. What I can tell you is there's a planning process that the state is running, and as a planning process, they've hired an outside consultant who is leading a community advisory group. For the city, Jen Tracy from the Mayor's Office of Recovery Services, Chief Dillon from D&D, and I think Chief Cook from Parks are sitting on that advisory group, which is weighing in on the community process. But again, this is the state process. They, as people may remember, they are moving some of their services from the Shattuck, and they are looking to sort of redefine their buildings and likely build a new building and think about the services that are there. So they are knee-deep into that process. I can give you an update with more in-depth information, but they have a schedule of meetings that they're engaged in, and this advisory group is helping to shape what ultimately will be the plan that they release and get feedback from. But they're still in that process today.
Did you want to add, Chief?
Sorry.
Thank you. Thank you so much.
Janie, we do have 3 individuals who have signed up for public testimony, so I'm going to take that now before we do another round of questions. So if we could have Sue Sullivan, Jonathan Scott, and Sarah Porter for testimony, please.
Good afternoon. I'm Sue Sullivan. I know a lot of you. I'm the Executive Director of the Newmarket Business Association, and I'm representing over 200 business owners and 20,000 employees who work in the Newmarket area. Newmarket is truly the face of a crisis out of control. Every day, there are hundreds of people standing on the streets, street corners, trading pills, shooting up. There are drug dealers populating our restaurants and our street corners, and on any given day, there are tremendously impaired individuals falling into the street or swaying into traffic. Our businesses and our employees are frustrated, not with the problem, but with the feeling of fighting against a continually rising tide. What we see out there is inhumane. Many of these individuals on the street have sought long-term recovery. Sadly, there is a severe shortage of long-term treatment beds in the Commonwealth, and this absolutely has to change. Our current quantity and breadth of addiction services is not enough to handle the crisis of addiction that we are faced with in the Commonwealth. We need to create a more holistic approach surrounding the treatment of the addicted by providing a safe environment in which they can manage their health, work to overcome addiction, and manage their mental illness. It needs to focus not just on recovery, but on long-term stability. We fully support Mayor Walsh and the city's proposal to build this state-of-the-art comprehensive facility on Long Island, where there is significant infrastructure and buildings already in place, available land for expansion, and the clearest pathway for the addicted to thrive in treatment without outside distractions and temptations. And the question becomes, how do we transport these individuals to the island? The only logical answer is rebuilding that bridge from Squantum to Long Island. While a costly venture, it is logically the best choice by far. We applaud the city's aggressive plan to rebuild the bridge and open this addiction recovery campus. It is actually our hope that this will become a model for more of these much-needed facilities across the Commonwealth. Addiction is not just a Boston problem. Addiction in Massachusetts today affects everyone. In order to reverse this crisis, all of our cities and towns need to step up and embrace the addicted in their own community and stop stigmatizing the afflicted. Quincy needs to stop sending their addicted to Boston while fighting a NIMBY fight against the bridge. And by the way, I speak of this firsthand, from firsthand experience, because I lived in Quincy on the road out to the island for several years when Long Island was operating previously. There was no negative impact whatsoever. In fact, there was no impact at all. Building this campus is not the solution to stopping addiction from happening, but it is an important first step by which we can ensure that those who are addicted have the greatest chance of recovery. I'm going to add one more thing, and because it came up a bit earlier, and that was, what do we expect to see at Mass and Cass? What do we think this is going to achieve? And the answer is, and was earlier, it is a multi-pronged approach to solving the issues. We did not get here overnight. There are people who are addicted. There are people who are unfortunately homeless. There are people who are from every step of life, from mental illness, from those that just have nowhere to go. And it is a multi-pronged. It is decentralizing methadone and not having 1,300 methadone patients all in one place. The governor's bill that's been enacted recently to study servicing methadone, distributing methadone out of pharmacies. That would allow not 39 communities to be having methadone patients, because everyone else wants to stigmatize them, but it would embrace every community. Every community in the Commonwealth would be embracing those with addiction issues. It's not just that. It is so many different pieces of it, but this campus is a necessary first step, and I truly believe it is important that the state of Massachusetts, the Commonwealth, follow along and have more of these going forward. Thank you.
Thank you, Sue. Next, we have maybe Sarah Porter. And then we'll do another round, a quick round from our colleagues, and finish up with public testimony.
Sure. Hi, my name is Sarah Porter. I am the Vice President and Chief Operating Officer of Victory Programs, and I'm pleased to speak for thank you to Councilor Essaibi-George and Councilor Wu and all the members of the Boston City Council on behalf of Boston-based victory programs to provide, Boston-based victory programs. And we're here to provide, thank you for providing united support for the reconstruction of Boston's Long Island Bridge and the reopening and opening of the proposed recovery community. I want to thank and acknowledge the great effort of Sheila Dillon and the Department of Neighborhood Development, who were incredibly key in providing major effort in relocating victory programs as well as the other two addiction treatment programs who were located on Long Island, Bay Cove and Volunteers of America, when the bridge closed. We ran Jolene's family home at the time of the bridge's closure, which was 47 recovery beds for women. At the time it closed, all of the women were relocated for the night and eventually longer term. In addition, as an employer, all of the individuals who worked in that program lost their job that evening. So we were able as an agency to work to kind of allocate those people throughout our agency to make sure that we didn't also have kind of a workforce crisis at the same time. So for 4 decades, Victory Programs has specialized in long-term residential care, placing some of the hardest individuals and families affected by substance use. Last year, we as an organization provided care and treatment to just over 2,500 individuals, along with about 100 dependent children. Last year, we also started to think about what we're calling the opioid syndemic, and the idea of other epidemics that we're seeing an increase in, be them because of the opioid epidemic. So be those a spike in hepatitis C, increase in HIV infections, hepatitis A of late. How do we work together to make sure that all of these epidemics, which are happening and taking place because of intravenous drug use or related to intravenous drug use, how are we addressing that? So Mayor Walsh's primary commitment to this year's City of Boston budget to rebuild Boston Harbor's Long Island Bridge to establish a recovering community of services on the island is critically necessary, urgent, and very much historically aligned with the last 150 years of human services cited on Long Island. Boston proper, as you know, is now an expensive, high-ticket real estate city. Today, for a community-based organization seeking affordable and accessible housing stock to build a recovery center or a recovery home or any type of recovery services is at best financially daunting and at worst an impossibility. Trying to cite even a small recovery group home treatment program for those seeking recovery and help is formidable, often takes years, and many worthy projects fail to even break ground. It took us 2.5 years from the time that Jolene's closed to reopen it in the Roxbury-Dorchester line, and that is considered kind of unbelievably quick, 2.5 years from the time it closed to the time it opened. Although the world has changed a lot in 40 years, supply and demand hasn't changed. The dire limit of supply for treatment and highest demands for service beds has not changed. In our 40 years of waiting lists for those seeking treatments has never stopped and has rarely, if ever, slowed. As of today, we have 6-month waits to get into our recovery homes. So even for those who have a high priority, you're still looking at 2 months from the time you get on the list. To reiterate, it's essential for the Boston City Council to remain aware of the Commonwealth's plan to close all the programs at the Lemuel Shattuck Hospital within the next few years due to the structural concerns. Victory Programs operates 2 vital addiction treatment programs at that site for City of Boston residents. One being Women's Hope, which is a stabilization program for 32 women in the very early stages of recovery. That program was founded in 1986. We also run what's called the Living and Recovery Community, LARC program, for 25 men and women who are living with HIV disease, addiction, often a mental health condition, and homelessness. They are some of the most compromised, fragile individuals that we serve, and probably in the city of Boston. Reopening Long Island would be appropriate and fundamental public health measure for the city of Boston to continue treating and supporting these residents. Additionally, those of us who are doing this work often have creative ideas, solutions, options, things we'd love to see happen that we rarely have an opportunity to kind of do. The idea of to respond to an RFI, to put some of those on paper and have them be considered as we build and look at building what's going to happen on Long Island is really exciting. We also are willing to go first. We will be the ones that reopen our program the minute the bridge opens. Boston Harbor, Long Island has the potential to again be a powerful and important resource for addiction treatment, long-term support for recovering addicts for our city. We applaud Boston City Councilors' early and ongoing support for the reconstruction of Boston's Long Island Bridge, the reopening of the proposed recovery campus. This vision has the potential of becoming a national model and a legacy for all those working diligently to rebuild the island's only access bridge. Thank you so much.
Thank you very much, Sarah. So we're going to do a quick round here. I ask us all to be quick with our questions, and if you could be concise with your answers, that would be helpful. Just one quick comment before I ask my question. I think it's important when we look at what's happening at Mass and Cass, when we think about planning for what's happening on what will happen on Long Island, that we're reevaluating how we're clustering services. Because one item that we hear quite a bit about is at sort of Mass and Cass, there are both recovery services and those that are in active addiction, and the two of them mixed together is very challenging for individuals, especially that are seeking that lifetime of recovery. Two quick questions. One, can we get boats moving out there to provide any services in the meantime or as soon?
Repeatedly from the program providers is that you need a bridge to be able to provide the level of reliable transportation to actually run an effective program. There is obviously a ferry that sort of during the summer serves Camp Harborview, as Chief Martinez mentioned, but in order to run the type of services that we expect to run on the island, it really requires the bridge.
So the administration has boats are off the table for programs?
I'm sorry, Councillor, if I can add, when we talk of ferries, the subtlety that is not properly articulated is whether they are passenger ferries or passenger and vehicle ferries. For the type of treatments that Chief Martinez provides, you need a ferry that can, if I can say it as bluntly as possible, it needs to carry vehicles, service trucks, and passengers. We don't have that capacity in the greater Boston area.
Okay, thank you. And then if we were to look at this point in time, what are we missing for the number of recovery beds? What would make a dent in the work that we're doing right now?
That's a hard question to answer with a specific number. I could give you a better estimate offline, so I can give you that. We know where you heard waiting lists,
right. So
we have a bigger picture, but I can give you a number with some of the providers that we've worked with, so I can give you that.
Great, thank you. That's it for me. Councilor Wu. I'm good. Councilor Flynn.
Thank you. Thank you, Madam Chair. I know I referenced this at the beginning of my opening statement and question, but I just wanted to follow up again. I know we have great wealth in this state, but can we consider engaging the businesses in Greater Boston to possibly seek a voluntary tax, such as we have with the pilot program? Record profits are up. Maybe these businesses would be willing to help as part of the solution. And I guess my second part of the question is not to pick on any specific city or town, but towns that are very wealthy, such as the Wellesleys or the Dovers. Do you think we could also engage them to see if they would be part of the solution to help their fellow citizens across the state get into a drug treatment program? I think it's critical. It's not just a Boston problem, as I mentioned. It's a state problem, and those with the great wealth, such as these great businesses that are in Greater Boston, they should be doing their part as well. Any thoughts about that?
The only thing I'll add is I think, obviously we think everything's on the table. We think everything, every resource, every partner's on the table. I will say our business community, many of them are stepping up and doing many things, but again, whatever we can do to garner more support, everything's on the table to us.
Thank you. And then my final question or comment is myself, Councilor Janey, and Councilor Baker do have a hearing scheduled to discuss quality of life issues that are happening in the impacted areas, whether it's Roxbury, Dorchester, the New Market area, South Boston, the South End. Do you have any advice for us in terms of what communication we can establish with the residents about how the situation will improve the quality of life for our residents? What can our residents do in the meantime? We want to make sure that we are staying on top of quality of life issues in those areas, and that's critical as we deal with helping people get into drug treatment. But it's also critical dealing with the quality of life issues for those residents in those impacted areas.
So yes, we could probably give you some information. I mean, I think one of the things to stress is that the city is an all-hands-on-deck sort of mode around these issues, right? So it is not just public health, but it includes streets, it includes DPW, it includes public safety, all folks looking to work on neighborhood-level issues, right? So I think that that's, we're all working to sort of address some of those things and are open to ideas and thoughts that have come in from neighborhood groups, many of which we've implemented. So I guess that's what I would stress, is that the city's fully working on all these pieces and understand that, in the face of an epidemic, there are challenges that are beyond our control, but we're working to address them.
Yeah, thank you, Chief. And as we do deal with this epidemic, can we also focus on the impacted neighborhoods in those immediate areas and making sure that not only do they get their basic city services, that we also factor those special considerations in when we're providing those basic city services, that we may need to spend more time, effort, resources in those areas because of the ongoing crisis.
Absolutely, absolutely.
Yes. Thank you.
Thank you very much, Madam Chair. Just quickly, there's no doubt that this administration is trying to address this problem, and we certainly appreciate it. But I think, as Sue Sullivan said late, she's done such a great job with the businesses down there. You've got 20,000 people who work there, so although we're addressing the people who are in the throngs of this crisis, we also need to make sure that the people who work there, the businesses that are there, are held whole as well. I mean, there are 2 hotels down there. I don't know how they stay open, to be honest with you. I come in from Hyde Park. I generally go by Mass Ave to come into work because you never want to jump on the expressway, obviously. And I see it every morning and every night coming home. And how some of those, there was a Cumberland Farms that was there and now is out of business. If Cumberland Farms is going out of business, that's a telltale sign that things aren't well in and around that area. So as we continue to focus for the future, we do need to address some of the problems that are there now. And I know you're trying, but there really has to be a focus on that, because that stretch from the old from fire headquarters in and around the corner is something like I've never seen in Boston. Thanks.
Thank you. Just a follow-up question on the BRJP goals. So it's good to hope to meet the goals. I'd like to understand what the plan is to meet the goals. Like, hope is not a plan, so I just want to understand what it is that will be done to ensure that we're hitting the mark.
Council, if I can get back to you on that. Right now, we are focusing on getting a design, and we will continue to abide with all city regulations, but hopefully you will afford me the opportunity to come back to you with more specifics on that, if it is okay with you.
No problem. I appreciate that. One other question, please, Madam Chair. So I've had the opportunity to visit several homes that serve people in recovery who are rebuilding their lives, and I've seen some pretty amazing work happening in my district, which is great. When I visit these places, though, I don't see everyone being represented in the home. And so I guess as we talk about the Long Island campus, as we talk about other places that do recovery work, I'm really interested in making sure that, so we know that people who have substance abuse disorder, it's not based on race or zip code. It can impact anyone and everyone. But when I visit these places, I don't see that reflected. So there are a couple of places in my district that I've gone to, and you know, my district is largely people of color, not solely people of color, but I don't see people of color represented. And so I'm hoping that someone can speak to how to ensure that the Long Island campus and that other areas, as we partner with providers, that there's more equity and inclusion.
Yeah, absolutely. And Councilor Jane, I think you're correct. I think people of color are not being able to access the programs that they need to access. I think if Dimmick was here, they would tell you that the only program that they have that is not majority people of color are their treatment programs. Most of their programs do not serve the same population they serve for everything else they do. And so one of the things we're doing is to better understand what are some of those barriers to getting into those programs, what are both from how do we ensure programs are culturally competent? How do we ensure that diverse communities understand the pathways and the continuum of care? And how do we make sure that people in diverse communities understand the services and resources and opportunities? The state data showed us, this last state data, that the overdose rates among Latinos and then African Americans has dramatically increased in the face of this epidemic. And so we know that we have to ensure that we eliminate any barriers and that we ensure that there's equity in terms of access to care and treatment. So it's in the forefront of our work, just so that you know that.
Thank you. Thank you.
Thank you, Councilor Janey. So we'll finish with public testimony. You're welcome to stay in the pit or the panel stay here or watch from the side. I'd like to call up Savina Martin, or Marty, actually, Savina Marty, and James Shira. And we have 2 mics, so if you could find your way to both mics. And we also have Amy Coolidge and Michael Kane.
Good afternoon. Can you hear me okay? And I respect everybody's method of approaches and the way we're trying to come up with solutions, but it's just not enough, respectively. My name is Savina Martin, and over 30 years ago, I was just getting out of the military and had a tragedy in my family, and I know what it is to become addicted to your medication. I became an activist for other women that were in the same situation. And Mayor Flynn, during the time, decided to give us some help. He didn't appreciate the way we went about it, but we were desperate in the communities of Roxbury, Dorchester, and Mattapan. There's an influx of heroin and crack cocaine. We took over an abandoned home, held a protest, got arrested, and then later on acquisitioned the building for $1. So I'm the former executive director of the Women's Institute for New Growth and Support. We wrote tons of grants, had a feasibility study done by, back then, the Public Facilities Department. But let me tell you something, sir. We had to do a lot of work. It took us 3 to 5 years, but before we even got the master plan in place and had that feasibility study to house 8 to 9 women, we had to do a community needs assessment. We conducted a community needs assessment. We door knocked in that community. In the Hawthorne area, they did not want, because of the stigmatization of women and men who are in recovery, they did not want us there. Why? Because they had no education. So we had to survey. We had to educate the community. Okay. So here it is 30 years later, and that house is still providing homes for women. The gaps in services that we found out was that single mothers who were addicted often lost their children to foster care, and they couldn't get into a regular, they couldn't get housing, right, because they didn't have their children. So we provided those 8 to 12 rooms for women to live there for up to 2 years. Recovery takes time, right? So here we are, 30 years later, the conditions have got worse, right? We have a homeless, housing, and opioid committee, We're on the ground here. We're doing the same thing now 30 years later. But in Roxbury, Dorchester, and Mattapan, we belong to a group of well over 300 to 400 recovering men and women that are recovering and productive members of society today. Their children are not drug addicted. Now, I believe there's some correlation, there's a lot of violence, but we've got to look at that. There has to be some critical thought here in terms of what we're doing, or people are going to continue to overdose in mass numbers. And we're going to continue to advocate, educate, and activate people on the ground. Perhaps we will have to take over abandoned buildings to put people in because of the desperation right now. This is a man-made health crisis. It's a man-made health crisis. My master's thesis was on veteran homeless women and the lack of service availability. Today, I am in the middle of a participatory action research project for my dissertation. Something needs to be done, but you need to invite us to the table. I understand what it is to be addicted. We had to partner with DIMIC community centers, but today, I'm a little righteously angry because we're not being represented. So you must invite us to the table. You can't keep preaching to the choir. These services are important. They're important, and we've got to begin to, host those focus groups of people who are in recovery and being represented. Okay, I've got a lot to say, but I won't go there. There's a little bit of emotion here because women are dying, right? Women do not have enough beds at all. 30 years ago, when we conducted a survey, on any given night, there were upwards to 1,500 people waiting in line for treatment. We found out during that time that there were only 3 detoxification centers. So something is wrong. We must institute, better best practices, other methods and approaches. We've got to think outside the box for this particular time. We're dealing with a whole new animal of fentanyl. And what does that really mean? I wish you would have had some numbers here, some data that we could really see. We need to know what's happening on the ground, and particularly the grassroots organizers. We're dealing with it every day. I know all of the folks that have relapsed. I'm out there on the ground by Dunkin' Donuts at Mass and Cass. We're there. We're meeting in Dunkin' Donuts trying to figure out what are the services that you need. You have outreach, folks. Use us. Let us be a part of this process. Mayor Flynn did it. He put us in his peace plan. We spent months and months and months here. Jim's here, Jim knew it. Michael Caine, and other folks that are still on the ground 30 years later. I've worked all over the country, from California to Arizona. I've worked everywhere. And I'm back here in Boston, working on the ground again, organizing. Thank you.
Sabina, thank you very much. Thank you. James? Amy? Oh, James is here. Hello.
Afternoon, everybody.
Afternoon.
Thank you for this opportunity for being here. First, I want to read something. The sudden closure of Long Island Shelter 4 years ago resulted in an unplanned worsening of what was already a dire situation. The resulting catastrophe, chaos, and chaos for nearly 1,000 people struggling with drug use and homelessness, resulting in many overdoses and needless deaths and suffering. Soon the new ground zero for this health emergency came to be known as Methadone Mile, an open-air land of the lost and downtrodden where our sisters and brothers wander about in their daily struggle for survival in an endless circuit of misery, from emergency room to detoxes to dangerousness and overcrowded public shelter to methadone clinics to halfway houses and transitional programs that more often than not are a transition to nothing but further homelessness. While we recognize the need to rebuild the Long Island Bridge, we need a ferry service now so that services can be rebuilt on the island as soon as possible. At the same time, we declare and will not compromise on our demand that everyone that lives in the city of great wealth should have a decent place to live, and that shelters are not a remedy, but rather a symptom of moral failure and real estate greed. We will no longer settle for crumbs. Having said that, one of the things that came out today was the fact that there's not going to be any shelter services on the island. People are not on Methadone Mile or Molina Cas just because they're using. There are people out there that have no place to go. We all know that the shelters are overcrowded constantly. Winter's coming, and it's going to be that way again. When Long Island Shelter was open, and as a formerly homeless person, I was comfortable in the fact that if I couldn't get a bed in the city, I could get to the island. You know, and that should happen. There needs to be shelter services along with the recovery service back on that island. Period. No doubt about it. Because if we don't do that, things down in Molina Cas are not going to change, and people are going to continue to die. Thank you.
Thank you. You can
Hi.
introduce yourself for the record. Thank you.
Sure. My name's Amy Coolidge from Pine Street Inn in Boston. And I will try and be brief because there's been a very eloquent description of what our issues are here today. So I'd like to talk to you just briefly about homelessness and how this all affects homelessness. At Pine Street Inn, we're serving about 1,600 individuals, homeless individuals each day in both shelter and in housing. And of those we serve, many of them struggle with addiction, and as a result, they languish in homeless shelters far too long, and that's because of the lack of availability of treatment beds. The opioid epidemic has presented our shelter operations with challenges that we are often ill-equipped to face. We do our best to stabilize those with addictions, but long-term care is what is really needed. Our shelter beds remain full because recovery beds are just absent. Before the bridge came down, Pine Street Inn operated a 200-bed program for homeless men out on Long Island. And within that structure, 50 men who suffered from addictions were enrolled in a recovery program there. And we found that the island was the optimal location for recovery programming, as it's free from, as has been discussed, distractions and temptations. Having a continuum of recovery services in one location that spans from detox to long-term treatment in a safe recovery community is what's needed. In fact, I would say for those who are struggling with addiction, it's a game changer. And again, for those individuals who are struggling with these addictions, that is a game changer for them. So we believe that the existence of this recovery campus on Long Island presents a tremendous needed treatment opportunity for those who are suffering from addictions, and we ask that you look favorably upon this plan. Thank you.
Thank you, Amy. Michael?
Thank you, Counselor, and thank you all for holding this hearing. And want to commend the plans that are underway from the city. It was very impressive. I'm Michael Kane. I work for the Mass Alliance of HUD Tenants, but I've been volunteering with the Boston Homeless Solidarity Committee since the shutdown of Long Island. And as you know, that includes people that we've reached out to that are currently homeless, people that were in recovery and on the streets immediately after the shutdown. And we have been very critical. We were very critical at the time, not just of the decision to tear down the bridge, but the really separate decision to shut down all the residential recovery programs. There were 265 people in 11 programs that were living on Long Island, and they were displaced with no notice or plan and put on buses and trundled over the bridge that had just been condemned. And we never quite got an adequate answer as to why that decision was made or why there was no alternative plan. But I think the mayor is to be commended for recognizing that we all think this. I think that in the committee that the recovery campus concept is ideal for Long Island, for people who need to be out of the triggering environments when they're in recovery. So that, I think the mayor is to be commended for finally making that commitment, and we should all be supportive of him on that. But the main, since the shutdown, we sponsored a couple of resolutions here at the council in early 2015. The council created a working group that came out with a report, which you may not, this was from 2015, I can share it with the chair. And it summarized a lot of the recommendations from the community at that time. And a lot of what is going on now is responsive to those recommendations, so that's why the mayor deserves some commendation. The council never actually took action at the time. It was just a report, and there may be some opportunities now. One specific idea, and this we would ask you to consider this, is to go back to the idea of using boats, ferries, and an ambulance boat in case of an emergency, and to reopen the clinic. There was a clinic, it was a 24-hour clinic staffed by medical volunteers that was on Long Island up until 14. Remember that Long Island operated without a bridge until 1951. There were over 1,000 people out there. So if the technology existed to get people and supplies back and forth from the island, then it clearly does now. There are, if you Google ambulance boats, there are 10,000 entries that come up. There are islands all over the world that are isolated that use ambulance boats for emergencies. And you can actually have them tailor-made. There are companies that will do that upon, whatever you want, including an ICU unit in a high-speed ambulance boat. It might actually be faster to get from Long Island with a high-speed ambulance boat to, say, Mass General than it would be to trundle over a bridge to go into downtown Boston. So I think if in your planning, if you could work that in case the bridge is delayed or blocked, you have a contingency plan. Now, what we were told at the time was that the state said no, and we asked the state, and they actually said that wasn't quite true. The city had never filed a plan, a safety plan for them to review, so they hadn't really said no. Since then, Monica Burrell, who used to run the clinic on Long Island, has met with our group and shared that it didn't work very well. It wouldn't work very well to use an ambulance boat for a detox program because of the high rate of emergencies. So it may not be appropriate to have a detox program if you're using ferries. But all the other kinds of residential programs can be assessed in terms of their liability and risk, and that would address the problems that the providers would have with insurance. So those were the obstacles that we were told were the reasons why the ferry option really wasn't being considered, even though at the time, you may recall, Jack Connors offered to pay for a ferry out of his own pocket for 5 years and to pay for upgrading the ferry dock to be an all-weather emergency dock. He was willing to do that then. He could be approached now. But that option really should be worked into this, we think, and that way you may be able to get services out faster as well and not have to wait the 3 years. Services out faster to deal with the crisis and emergency that you just heard about from Savina. So that's what I wanted to share. There's a list of the people that's testified at the hearing then. A number of them were people whose lives had been saved by that recovery campus at Long Island. We have a board member in our organization who was one of them. John Lehner, another who lives in Quincy now. He had his life turned around then. And those people who lost their lives because of the displacement that occurred in 2014. So there's some urgency to this. We appreciate your holding this hearing, and please take that into your planning. Thank you.
Thank you, Michael. At this time, any closing comments from my colleagues? Councilor Campbell.
Just a thank you to folks who testified and also for your patience in waiting to testify. Because we have this awesome, incredible website, and it's a place where people can be directed to not only to await information related to the Long Island Bridge, I think it could also be an incredible space to speak to some of those gaps that we talked about earlier and our planning for what we need to do now in the short term and the long term to meet the immediate needs, not just of that area that we were talking about, but the wider issues that came up today and that have come up beforehand. It might be the financial barriers or gaps in the work we're doing to address that. It might mean some of your proposals in terms of expanding Jen's team and others. And I think if we articulate what some of those gaps are, it allows community to weigh in and say, this is this is how I want to play a role in filling that gap. And we see the community as partners in the work, right? And then, of course, we on the council, I know all of us, I can speak to the council as a whole, are ready and able to support, and I think each person has demonstrated in their individual way the work that you guys do, the hard work of the Office of Recovery and so many others. But I think having that in a space where people can see it and also see what we're doing with respect to meeting those needs would be extremely helpful for all of us. And so I look forward to continuing the conversation. And I also want to thank Councilor Essaibi-George for partnering on this hearing order way back when, right after the inauguration. So thank you for your hard work in this space too. Thank you.
Thank you. I missed Cassandra for her testimony, so go ahead. Just introduce yourself for the record, please.
Sure. I'm Cassie Hurd. I'm also a member of the Boston Homeless Solidarity Committee. I work with community members experiencing homelessness in Greater Boston. I just had 3 really brief things I wanted to say. The first is that this is such an urgent need. It's been 4 years. It has been now 10 months since this hearing order was made, and we lose 6 folks every day. So, you know, the urgent, dire need is here, and that hadn't been said yet, so I wanted to make sure it was said. The second is that, you know, the island is there for the purpose of the health and wellness of the community members of Greater Boston. We do currently have a private use for private profit on the island. That is for Be Good. My hope is that it would be returned for the health and wellness of the Serving Ourselves program, people in early recovery. People in recovery could certainly benefit from both working on the farm and the organic food that the farm produces. And lastly, that I would hope that this hearing could be continued and we'd be able to gather actual information once folks are able to get that together. But thank you so much, and thank you all for calling this hearing.
Thank you, Cassie. The hearing will be adjourned. I will say, although that the hearing was called for many months ago, we've done a lot of work along the way through our budget process, through some of the Ways and Means appropriations, and through some of our other work as a council. So it's not, although this is the official hearing on this hearing order, we've had many public conversations that included the guests that were here today on the panel, the Office of Recovery Services, Boston Public Health Commission, EMS, the whole 9 yards, and more. So I appreciate you being here today once again. Appreciate the work that you're doing and the effort ahead. I would just like to echo, I think some of our colleagues here today mentioned the need to use us for support as you go forward with this work, especially with our neighboring cities and towns. We look forward to the website and our planning process going forward. Thank you all.